Good morning.
Good morning, Karen. How are you?
Good. How are you?
Doing well. Thank you for asking.
Good morning.
Busy with you? Karen,
Yes, I'm sorry.
busy week for you?
Oh, yeah.
Morning, Miss Dudley. Are you ready to rock and roll?
I'm ready when you're ready.
Wonderful.
Can you hear me okay?
Yes, ma'am.
Okay.
Just fine. Thank you. Do you swear the witness, please, ma'am?
Before I proceed, I will ask counsel to agree on the record that there is no objection to this deposition officer administering a binding note to the witness by video conference. Please state your agreement on the record, starting with Mr. Potts.
James Potts, no objection.
Trisha Godsey, no objection.
Olivia Beckett, no objection.
Ma'am, would you raise your right hand, please? Do you solemnly swear or affirm that the testimony you're about to give will be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Thank you.
Good morning, Miss Dudley. Would you state and spell your full name, please, ma'am?
Yes, my name is Miranda Dudley, Miranda. My last name Dudley.
And do you have a middle name?
Yeah, Darlene, Darlene.
And where do you live?
I live in Dallas, Georgia.
What's your address there? And do you use that number for patient care?
Not that direct number. I have an app on my phone that will direct the phone calls to my phone.
All right. And do you have a mobile device that you use at OrthoAtlanta Surgery Center, Austell?
Just that same one. I use my personal one.
4782. Thank you. Any other cell phone numbers?
No.
And what is the call forwarding app that you use on your telephone?
It's called 8x8.
Is that an app that you purchased or is that provided by OrthoAtlanta?
No, it's provided by OrthoAtlanta.
And do you know whether that's part of a larger system?
I'm not sure. I'm not sure.
Do you have a separate telephone number for 8x8? In other words, is there an originating number? Go ahead. You were shaking your head.
Yeah. The number, well, I know the number that people call to get me on there.
Ah, okay. And that's the, I assume, Austell Surgery Center?
Yeah. Mm-hmm.
Are you affiliated with any healthcare provider other than OrthoAtlanta?
I have a part-time job with a hospice group.
Yes, ma'am. And what's the name of the hospice group?
It's called Trinity Hospice.
And what is your role at Trinity Hospice?
I do like PRN case management with them.
Got it. And you're a registered nurse?
Yes, sir.
And how long have you been a registered nurse?
Since 2009. So like almost 16 years.
Right. And is that your role at OrthoAtlanta Surgery Center, Austell, as a registered nurse? Is that right?
Yes.
Are you an X-ray tech?
No.
Do you have any training as an X-ray tech?
Just like on the field training. I didn't go to like a radiology school or anything, but like in the ORs, it's hands-on training.
Mm-hmm. And do you have any training on the GE C-arm 9800?
I have hands-on training where I used it before at a hospital I worked at.
All right. What hospital was that?
Cartersville Medical Center.
Okay. I assume that's in Cartersville, Georgia.
Yes. And then I use that same model at Georgia Bone and Joint. That's also in Cartersville.
And are you also employed at Georgia Bone and Joint?
Not currently, no.
Right. When was the last time you worked there?
It was before I came here, so 2020 during COVID, yes.
Got it. Thank you. And there's an operator's manual for that GE C-arm 9800. Have you read that manual?
I have not read it. I've looked in it a couple times to try to figure out how to do different features on the CRM, but I haven't read it.
All right. Was that provided to you by OrthoAtlanta Surgery Center, Austell?
That manual, yeah,
Yes.
it's there's a hard copy that's on the machine itself.
Okay. They keep it on the back ledge behind the top?
No, there's kind of like a pocket on the monitor where we have like a USB drive, and then the manual just sits in that pocket.
Got it. So you're training on, and what do you want to call it? The C-arm, GE C-arm 9800? What's your?
C-arm, just
C-arm.
Mhm.
All right. And whenever we say C-arm, we're talking about the 9800 that you used on June 9th, 2022, when you were caring for Arlina Addison, right?
Right.
Okay. So that C-arm, you have on-the-job training, and that's it, right?
For the use of the C-arm, we do like a radiation safety course too, online. But that's the extent of the training, yeah.
All right. Are you familiar with biomed?
Like there's a company, are you saying like Biomet or Biomed?
Yeah, it's the company that comes in monthly and does the checkoff on the X-ray
Oh,
equipment.
Marcus? I know the guy Marcus who comes into, he does like maintenance on it. Or
Yeah, well,
anytime we have an issue, we call him for it.
well, does Marcus also come in the first of every month to ensure that the equipment is operating properly?
Yeah, he does our like inspections on them.
Right.
And like any like in between maintenance we need, he'll come in and look
Right.
at it.
And those are done at a minimum at the beginning of each month, is that right?
I'm not sure how often they're done.
And he works at, I think it's Biomed, right?
I don't know the name of the company he works for.
And he's a third-party vendor, but he's there at the hospital, or there at the OrthoAtlanta Surgery Center, Austell, to ensure that that equipment is functioning properly.
Yes, that's correct.
And he's there periodically.
Yes.
And you don't know whether it's every month, every 2 weeks. You don't know how often it
No,
is.
I'm not sure how often he comes.
But you see him
I
quite.
see him on a regular basis. I don't know at that time what it was, but I have a new position now where I'm not in the surgery center all the time, so I don't know how often.
All right. And you don't know how often it was in June 2022.
No, I don't know.
But when he is there, he does what are called checkoffs on that equipment.
Yes.
And he ensures that because it's X-ray equipment, he makes sure that those machines are functioning properly
Yes.
and safe for your patients.
Yes.
And if there was an issue with, say, the time, he would either correct that or alert you to it, right?
He never mentioned anything about that, but usually if there was an issue with the machine, he would tell me, like if the machine was malfunctioning.
And you don't recall him ever telling you that the C-arm was malfunctioning before June 2022, right?
I can't recall.
Well, you don't recall him ever telling you that that machine was malfunctioning, right?
I don't recall him telling me at that time if there was a problem with the machine or not.
Okay. All right. What problems do you recall him telling you about?
What is the time frame that we're asking
Yeah.
about?
Anytime before June 2022.
I don't remember specific dates or anything.
Nor do you remember him telling you about any problems with the equipment, right?
Correct, yeah.
Okay.
If there was, it might be in his records, but I can't speak to specific stuff. I don't remember.
All right. Now, are you familiar with are you employed by anyone else in any Piedmont medical group?
No,
Okay. And you performed or participated in the performance of epidural steroid injections?
yes,
And you participated as a registered nurse?
yes,
And you've also participated as a C-arm operator?
yes.
Okay. Now, what do you call it? You smiled a little bit.
As a tech, well,
Ah,
yeah. At that time, I had a lead position, so I just filled whatever role they needed me to fill that day.
all right. And you call that a lead position?
Yeah, I had a lead. I was like a lead OR nurse at that time.
Okay. And that's LEAD, right?
Yeah, yeah,
All right. A lead OR nurse. And your role was whatever was needed, right?
yes, yeah,
And part of the reason you would do whatever was needed was because you want to do what you can to ensure the safety of your patients, right?
yes.
And when we talk about epidural steroid injections, if I use ESI, we're talking about the same thing?
Yeah.
Okay. And what is your role at OrthoAtlanta Surgery Center, Austell today?
So today I work as like the pre-admission testing nurse. So
Okay.
I call patients like before procedures, make sure they're good for anesthesia and get any clearances they need. I've been in this position since probably May
May of
this
20.
year. Oh, sorry, last year, May of
That's okay.
2024.
And do you like that?
Yeah, I like it. I kind of had to take the position over for a friend who got sick. So
Oh, I'm
it's
sorry.
growing on me.
Got it. And back in June of 2022, when your role was, whatever the need, do you recall your role as an X-ray tech? Do you recall
Yes.
performing that role?
Yeah,
And,
I did that role frequently.
and when you did that role, you would do that the entire day. Is that right?
Yes.
And you would start, it's my understanding, around 7 in the morning?
Well, whenever his procedures were scheduled to start, yeah, we usually get there around like 7 a.m. if he has a 7:30 start time.
Okay. So you would see patients from 7:30 until about what time?
It depends on how many were on the schedule, but like sometimes if there are like 10 or 12, it would be till around lunchtime usually.
Okay. And what range of patients did you care for when you were operating the C-arm, with the C-arm tech? got
What do you mean,
how
like
many?
what procedures or?
Yeah, about how many per day would you,
Oh, for Dr. Lee specifically?
or anyone?
I mean, it could range from 4 to like 12, probably.
And what about for Dr. Lee?
Um, yeah, he usually had like 10 to 12 a day. That was normal for him.
All right. So when the patient started coming in at roughly 7:30, and those procedures, they would be in the procedure room where the surgery or the ESI was performed for roughly 10 minutes. Is that right?
It depends on what procedure, but for like a ESI, about that long, yeah.
Okay. And before the start of any of those ESIs, you would have what's called the timeout, right?
Correct, yeah.
And in that timeout, you would make sure that the C-arm was functioning properly, right? Among other things. And you
Among
would,
other things, yeah. But at the beginning of the day, we do that too.
right. So you do it at the beginning of the day, and then you do it before each patient procedure, right?
Yeah, yes.
And if there was an issue with the C-arm, you would, of course, let the physician and the nurse that was in there with you know about that, right?
Yes,
And if everything checked out, you would, see the patient, right?
yes.
Now, June 9, 2022, that's the day that you cared for Arlina Addison. Do you have any recollection about that day?
Do have some recollection just because it's not a normal thing that happens usually.
Yes, ma'am.
But yeah, I do have some. I was 9 months pregnant at the time.
Wow.
Yeah, I gave birth June 29th. So I feel like I have some recollection, yes.
Well, at least you held on for another 20 days. I'm sure that was a traumatic.
Yeah.
Yeah. I'd like to begin. Tell me everything you recall about that day.
I can't speak like just normal operating it seemed that day. I remember her coming in the room. She's familiar to us. We had done her before. So some
Right.
patients I don't recall, some patients I do recall more than others just because I've had multiple experiences with them. But everything just seemed to go like normal routine that day until like right after the procedure when she started having, symptoms that aren't routine.
Right. And that now, as far as Arlina Addison's procedure back on June 9, 2022, there's a preoperative phase, the procedure you were involved in where the C-arm is, and then a postoperative or PACU phase. Is that right?
That's correct. Yeah.
Did you participate at all in her preoperative phase before she was brought back to the procedure room at 1024?
No.
Okay. Did you participate in her care after the procedure ended at 1034?
Yes.
Okay. So you were there for the procedure from 1024 to 1034,
Yes.
and you cared for her after.
Yes. I pushed her out I'm the one like who pushed her out to the recovery room, and
Yes, ma'am.
I'm one of the ones that cared for her afterwards in the recovery room.
All right. And we'll go through that.
Okay.
Have you ever given a deposition before?
No, it's my first time after 16 years.
All right. Congratulations again.
Thank you. Thank you.
And are you aware that a deposition is a public document?
Yes.
And it stands for you as a registered nurse outside the confines of this case.
Okay.
Well, it would be available to physicians you may work with, other
Okay.
nurses you work with, things like that. So
Okay.
it would stand for you as far as what you testify about here today.
Okay.
It's not just limited to use in this
Okay.
case. All
All
right.
right.
Are you a member of the ANA? American Nursing?
Not currently. I used to be.
Okay. And what about the AACN?
AACN?
Yeah,
No.
okay. What about AORN?
Yes.
Okay. And what is the AORN?
American, it's the Peri-Op Nurses Association.
Yes, ma'am. And the ANA, are you familiar with their code of ethics?
I can't recite it offhand, but I'm sure I've read it before.
Okay. And you agree that that's something as a registered nurse in the best interest of your patients, you comply with the code.
Yes. Yeah.
Ever been a party to a lawsuit?
No.
Okay. Ever been disciplined for any reason?
Not that I can recall. I mean, I've been written up a couple of times.
Yes, ma'am.
I was a travel nurse for like 8 years, and different
Wow.
hospitals have different policies. You can do some things at some hospitals you can't do at others. So
Right.
I remember once I gave a high blood pressure medication that wasn't allowed on that floor with their cardiac monitoring policy, and I got
Okay.
written up for that.
All right. Any others?
Not that I can think of.
How'd you like being a travel nurse?
Oh, I loved it.
Really?
Yeah.
What'd you love about it?
Just the job change every 3 months was kind of refreshing, and new cities every 3 months. I really enjoyed it.
Was it regional or all over the country?
Oh, no, all over. I went to Alaska a couple times, Arizona, Pennsylvania. I've been all over.
Okay. And what was it? Do you remember the name of the group that you were working with when you did that?
Yeah, I did multiple groups. So I've worked with like American Mobile. Like towards the end of my traveling career, I tried to work with hospitals that offered seasonal contracts. So like Baycare Health System and the
Okay.
Banner Health System, I did a lot of work for.
All right.
Just I would like hop from different agencies to negotiate better prices.
Ever been arrested or charged with a crime?
No, I'm the only one in my family.
What's that?
You don't have to volunteer
Oh,
that
okay,
information.
okay.
Oh, I didn't hear it. I didn't hear your objection or,
I just said she doesn't have to volunteer that information about her family.
I'm proud. I'm proud.
oh yeah, I don't want to know. Yeah, yeah.
I'm proud. I'm proud.
Yeah. Proud. Yeah, there's a lot to be grateful for.
Yes, there is.
Let's see here. You agree as a registered nurse that you're required to do what's in the best interest of your patient
Yes.
and what's in the best interest of the safety of your patient?
Yes.
You understand there are Georgia statutes and regulations governing nursing practice?
For the Georgia Board of Nursing?
Yes, well, that's one of them. Are you familiar with the Georgia Registered Professional Nurse Practices Act? That's Georgia Code 43-26-1.
I'm not familiar with it.
That's okay. What about reporting patient abuse or neglect? Also a law under OCG.
Mandatory reporting, yes.
Yeah, under 3179. Is that right? If you remember, yeah. And the Georgia Administrative Code rules, I think that's what you were talking about, 410-11-01. Nurses, you agree, are required to use safe, ethical, and competent care for your patients.
Yes.
There are also federal regulations, particularly when you're billing CMS, Centers for Medicare, Medicaid Services, that also require nurses to monitor patients. You agree you're required to monitor your patients
Yes.
and intervene if there are life-threatening complications immediately after a procedure, like an epidural steroid injection.
Yes.
Same thing if your patient suffers from a stroke, you're required to intervene and do what you can in the best interest of your patient
Yes.
for your patient's safety, right?
Right. Mhm.
Are you familiar with the Patient Safety and Quality Improvement Act, PSQIA?
I'm familiar with it. I couldn't quote it or anything, but I've
Yes,
heard of it.
Do you agree that it requires you as a registered nurse to report adverse events, including procedural deviations from the standard of care?
Report to who?
Well, depends on who you report to.
Okay. Yes.
Okay. And we talked briefly about the American Nurses Association, the ANA Code of Ethics. Right?
Yes.
And provision 1, as a registered nurse, you're required to prioritize your patient's health and dignity.
Yes.
And provision 3, if you see an issue with patient care for one of your patients, you're required to intervene if you
Yes.
suspect unsafe practices.
Yes.
And that would include blind needle injection.
If that was happening, I definitely would say something.
Yes, ma'am. Have you ever participated in an ESI when there was an X-ray tech in the room and you were the nurse?
Like a trained radiology tech? No.
Okay. Have you ever been the nurse monitoring vitals, things like that, and had somebody else operating the CR?
Many times, yes.
Yes, ma'am. And have you, whether at OrthoAtlanta Surgery Center, Austell, have you yourself or observed an X-ray tech or another nurse slow a physician down? You know, physicians with 10 or 12 procedures ahead of them that day, you know, are interested in, you know, caring for all the patients. Do you recall that?
Just
Like-
object to the form. I'm not sure I understand what you mean by slow the physician down, but if you can rephrase.
Karen, please timestamp that. I object to any talking objections. You may answer my question.
Slow them down for what reason?
For any reason. I mean, you do a timeout before you start the procedure, right?
Yes, we do.
And tell me everything you go through during that timeout in addition to ensure the equipment's working properly.
So during the timeout, we read from the consent, the patient's procedural consent. We read the procedure that's being performed. And we specify what levels are being performed.
Yes, ma'am.
If the patient has any allergic reactions to any kind of medications, if there's any special considerations to consider, like if they were allergic to one of the medicines we were giving, we would state it during the timeout. And then the patient's date of birth we go over, and make sure everybody's in agreement to what procedure that we're performing. That's basically what we go over.
Patient's name, identity of the patient.
Yes, patient,
All also supplied by the machine.
correct, yes.
And OEC down here on the lower right corner, that's the name of the machine, right?
Correct, yes.
Also supplied by the machine.
Yes,
And the lower left corner, the 2 also supplied by the machine. That would be the image number, which would be 2 of however many there were, right?
correct, yes.
In the upper left-hand corner, the OrthoAtlanta Surgery Center, the date and the time, that's all supplied by the machine, right?
Correct, yes.
So none of that you would input, right?
No, correct.
And this immediately beneath, I'm going to blow this up so you can see it a little better.
Uh-huh.
Do you see how this 11:41:26, 1970-02-02, do you see that?
Yes,
Do you see how that's overlaid over top of the procedure time?
yes,
And the procedure time is, we got to enlarge it a little bit to see it, is 9:59:26. Is that right?
that's what it says, yeah.
Yeah. And all that supply, well, the OrthoAtlanta, the date and the time were supplied by the machine, the C-arm, right?
Yeah, I don't put any of that in.
And then the 11:41:26, 1970-02-02. I remember you testifying that Arlina had been there a number of times for your care, your help. And, you know, we've been supplied with those. I didn't see any overlay on any of those. Is that's not normally there, right?
That timestamp?
The 11:41:26, 1970-02-02 on top of the timestamp.
Yeah, I'm not sure how that comes, but like on the pictures, it does have those 2 timestamps, but I don't know like where that one's generated at.
Okay. But by 2 timestamps, what 2 timestamps are you talking about?
So where it says like under the OrthoAtlanta Surgery Center, that timestamp 6/9/22, the 9/59, that I consider that one timestamp, and whatever that is like over it, the 11:41, another timestamp.
Okay.
But I don't know, like I don't know what generates that.
All right. So, well, have you ever seen one of these films that had the 11:41:26, 1970 timestamp on top of the timestamp that was generated for the patient by the C-arm?
Yeah, I see where they usually do have 2 timestamps on them.
And you don't have any understanding about the 1970 timestamp?
No, I don't. I guess I've just never questioned where that timestamp comes from, but I don't know where it comes from.
But you've seen the 1970 timestamp before?
I don't know if it said 1970, but I've seen another timestamp there before.
Okay, but that's not something, when you took the screenshot, the 1970 was not there, right?
It had to have been if that is what was saved.
Had to have been.
Yeah. Because I take that image directly from the machine.
Right, well, you hit a button and that takes
Yeah.
the image, right?
You hit the button to take, Dr. Lee hits the button to take the image, and then he says, save that picture. So then I hit a button on the actual C-arm to save that image into the monitor.
Mm-hmm.
And whatever is saved on the monitor is what goes into the patient's chart.
Okay. So you don't know how the 1970 overlay gets there, is that right?
No, yeah, I don't know. We have a machine that we use that puts it on a USB for us.
Uh-huh.
And then we use the USB to transfer the photo over to the patient's electronic record.
Mm-hmm.
So I don't know where that timestamp comes into play, but it's on the picture, like when we save it on the monitor.
Okay. And you agree that Arlina Addison's procedure, time in the procedure room where the C-arm was from 10:24 that morning to 10:34 that morning, right?
If that's what the charting says, yeah.
Yes, ma'am. And you agree this 9:59:26 is not between 10:24 and 10:34, right?
Correct, yes.
And this timestamp, the 9:59:26 timestamp, that's automatically stamped in each image that you capture, right?
It is, yeah.
And you agree the timestamps are crucial for accurate medical record keeping?
I do, yes.
Do you agree that altering or obscuring that timestamp would be against your requirements as a nurse?
Yes,
You agree that as a registered nurse, you're required to report any ANA code of ethics violations,
correct, yes.
any sort of cover up, right?
Right, yes, correct.
And you agree that to cover up a medical record would be an issue for you as a registered nurse?
Yes, yeah,
And that's something that you would report?
yes. Well, it's something I wouldn't do in the first place.
Yes, ma'am. And I'm saying that if you saw someone else do it, part of
Oh.
your job would require you to report that, right?
Yes, yes,
And part of your training as a registered nurse is to ensure integrity of the medical records, right?
yes,
You agree that medical records are required to be accurate?
yes.
And that's for the safety of your patient, right?
Object to the form. You can answer.
I don't see how the accurate medical records goes to patient safety.
All right. For instance, you can't spend 24 hours a day, 7 days a week with a patient, right?
It depends.
Oh, okay. Well, if you did do that, I guess your husband and your new baby would have an issue and you could only have the one patient, right?
Right, I do continuous care with hospice. That's 24 hours.
Yes, ma'am. And you're with those patients 24 hours a day, 7 days a week? Same patient?
No,
Okay.
not 7 days a week.
So the reason, I mean, when you're caring for a patient, Yeah, because you can't be with that patient all the time. You want to know what happened before when you weren't with the patient, right?
Yes,
And the same thing for people coming behind you to care for your patient. You want to leave them accurate information so they know what happened when they weren't there, right?
true, but I can't change the time on the photo to reflect the actual time of the procedure.
You can't.
I can chart accurate times in my charting, but any timestamp that's done by the machine, I can't speak to that.
Okay. And if there was an inaccurate time on a machine, you would, as a registered nurse, you're duty bound to report that, right?
Object to the form.
You may answer.
I don't really pay attention to the timestamp on the machine
Okay. And why is that?
because it's not prioritized on my list at the time. My priority is taking care of the patient. I don't think, oh, let me make sure the timestamp on the machine is right. I'm just patient-centered thinking.
Yes, ma'am.
I would hope, it would be already taken care of, but
Yes, ma'am. And do you have a car? I guess you drive.
yes,
And is there a clock in the car?
yes,
And does that keep time automatically?
yes,
Okay. And you agree this machine also keeps time automatically, the C-arm?
I'm not sure how it works, but like my microwave, I have to go in there and manually change the time, and my oven too. So I don't know if this machine works like that. Can't speak to how that works.
Right. But you agree that, I mean, microwaves are, a couple $100 machines, is that right?
Yes,
And a C-arm costs north of $35,000, right?
Object to the form.
I don't know how
Answer.
much they cost.
You agree that it's a little different between a C-arm machine and a microwave as far as the importance of the timer being accurate?
I
Object to the
agree.
form.
Oh.
Go ahead. You can answer.
I agree, but I don't know the year this C-arm was manufactured, but there's also a difference in like the year of my car and the year of the C-arm.
What's that now?
There's a difference in the like year model of my car, which is like a 2020, and then the year model of the C-arm, which was made quite some time ago. So I don't know if the technology, I don't know how it stamps time, how it keeps track of it.
Uh-huh. So are you suggesting that the C-arm that you used on June 9th, 2022 is an older model?
Object to the form. You can answer.
What do you mean by older model? We don't have, it's not like the latest model, but I don't know what year it was made.
Okay. But any reason for you to believe that the C-arm was not operating properly?
No, the timestamp could have highly likely been wrong, if it wasn't set right, but as far as like taking pictures and stuff, it was operating correctly that day.
And if there was anything that was inoperative or wrong, you would have noted that in the patient's record, right?
About the CR malfunctioning?
Yes.
No, we don't usually know that in the patient's record.
Okay. You agree that, are you familiar with overexposure to radiation?
I just know that it's not good.
Right. And you understand that these are sophisticated machines, the C-arms, is that right?
I don't know much about how they operate. I mean, as far as like, they keep track of the radiation that the patient's exposed to. Yes.
Right. Yeah. And what they do is they keep track of both the time of exposure, right?
Yes.
They also keep track of the amount of the exposure, right?
Correct. Yes.
And that's important for your patient's safety, right?
Correct. Yes.
To ensure that your patient is not overexposed to radiation, right?
Correct. Yes.
And there are safeguards in this machine for that purpose too.
Yes, there are.
And as a result, the time of a patient's exposure is important.
Yes. And it's on the photo too.
Right. It's critically important, right?
Yes.
Now, the overlay, you said the 11/41/26/1970 you don't have any idea what that was, right?
No, I don't. Yeah.
You agree that Arlina Addison's, this picture was not from 1970,
I
right?
agree. Yes.
And it was not February.
Correct. Yes.
It was not the second day of the month, right?
No, it wasn't.
And it wasn't at 11:41 that day, right?
Right.
You agree that this overlay, the 1970 overlay, partially covers the timestamp?
Yeah, it does.
Yeah. And you agree that that date and time, 11/41 in 1970, do not correspond to Miss Addison's procedure, right?
Correct. Yes.
And you agree that's not a standard feature like the rest of these, as far as the font, the size, all those things, everything other than 11/40/26/1970 is generated by the machine when you take the picture, right?
Object to the form.
Let me answer.
Everything that's on there is generated when we take the picture, except for what's in the top left-hand corner.
Well, I thought you said the 1970/02/02, that part, which you characterize as the second timestamp,
Uh-huh.
right?
I don't know when that's generated.
Okay. But it's not when Dr. Lee is taking pictures and he's putting the needle in, that's not there, right?
I don't know if it is or not.
Okay. Well, is it your testimony that this 11/41/26/1970 is a standard feature of this film, these films?
Check to the form.
I can't say if it's a standard feature or not. I don't know.
Okay. And you say it appears on all of them. That's your testimony?
It's not something that's like just on her picture. No.
Okay, so it appears on the other films.
Yes.
Okay. When you do a C-arm film, the 1970/02/02, the second timestamp is there, right?
Not those exact numbers, but
But there's always a second timestamp.
yes.
Okay. And you don't know how it gets there?
No, I don't know. I didn't even notice it until just like when you showed me the picture.
Yes, ma'am. Have you reviewed any documents regarding Arlina Addison?
What do you mean by that?
Reviewed any documents?
I just go over what my lawyers say. I mean, I just talked to them about it. I haven't reviewed any documents.
Okay.
Just like the letter subpoenaing the
Yes, ma'am. And I don't want you to tell me what you talked with your lawyer about.
okay. Okay.
So, yeah, you haven't reviewed any documents regarding Arlina Addison, right?
So he's not entitled to know what we talked about in preparation for your deposition, but he is entitled to know, like, if you reviewed any medical records or anything like that, any documents in preparation for your deposition. Tell him that.
Like any legal documents?
Any document regarding,
For medical records.
I reviewed medical records like I don't know. I don't understand.
Okay.
you reviewed medical records regarding Arlina Addison?
No, I haven't reviewed medical records regarding her.
Okay. Have you reviewed any documents regarding her?
Like the paperwork they sent.
What, the paperwork about your deposition here today?
Yes, yes.
Anything else?
I can't recall anything else that I've reviewed on her.
Any conversations regarding Arlina Addison with anyone at any time?
Other than with your attorneys.
No,
Right.
just my attorneys.
Okay. You agree that altering a timestamp on a C-arm picture would mislead a reviewer, right?
Yes,
And obscuring the original timestamp or what you called, I guess, the first timestamp,
mm-hmm.
that could mislead reviewers about the timing of the procedure.
Yes,
And obscuring the original timestamp could be intended to hide errors or misconduct.
Object to the form.
I guess I don't understand. You can't change the timestamp on there. It's like imprinted on there when you save the picture.
Right. And you're talking about timestamp 1 or your timestamp 2?
Both of them. They're just on there when you, like when I hit save on the C-arm, they're on there. So I can't go in and alter those.
Okay. You agree that this numeral 2 in the lower left corner, that's the image number. This is the second image number.
Yes,
Okay. So there would have been another image before that, an image number 1. Is that right?
yes.
Now you uploaded Arlina's C-arm pictures to the medical record?
I'm guessing, yes.
Well, I don't want you to guess. If you don't
Yeah.
know, you tell me. Get to it.
Yes, as a X-ray tech, that is part of the job duty. Like when we're done with the day, we upload the pictures to the medical record. Yes.
Okay. And you would have uploaded, if there were 2 pictures, you would have uploaded both the pictures, right?
No.
Okay. How many would you have uploaded?
Whatever the doctor tells us to save final, that's what we upload.
Okay. And what did he tell you to save final?
The picture that was uploaded to the chart.
And you uploaded that, I believe it was 1:41 in the afternoon. Does that sound about right?
Yes, when we're done with the procedures, though, that would have been after lunch. Yes.
And so when you uploaded that procedure at 1:41, Arlina Addison had already exhibited her decerebrate posturing, right?
That was after, yes.
Well, that was, no, the
No, I mean, the upload of the picture was after, yes.
okay. The decerebrate posturing was before you uploaded the C-arm picture, right?
Correct, yes.
Her loss of bladder function was before you uploaded the C-arm picture, right?
Yes.
Her tachycardia, heart rate went up to, I think, 168. Is that right?
If that's what the chart says, I can't remember
Yeah, we'll
exactly.
look at it. You agree anything over 100 in an adult patient is tachycardia?
Yes,
You agree that a heart rate of, say, 141 would be tachycardia?
yes,
You agree a heart rate of 168 would be tachycardia?
yes,
And a sustained tachycardia can be dangerous for your patient. Is that right?
it could be.
You agree that a normal respiratory rate, the respiratory rate is 18 to 20?
Yes,
And you agree that respiratory rate of, say, 36 would be high, right?
correct, yes.
And you recall that Arlina Addison, when she went into the decerebrate posturing, her fists were clenched so tight you couldn't take a pulse ox, right?
Correct, yes.
Her body was so rigid you couldn't start an EKG, right?
Well, we couldn't obtain an accurate EKG because of the shaking. That adds artifact to the strip. So yeah,
right? She also lost control of her bladder.
she did. Yes,
She involuntarily urinated on herself, right?
that's correct. Yes.
And all those things happened, and that was sustained for about 20 minutes or so with her.
Check to the form.
You may answer.
It depends, whatever the charting says, but
We'll go through the chart.
okay.
And so, and that happened during the procedure, right?
No,
Well, she was taken from the procedure room. It happened in the procedure room, right?
it happened. Some of it happened in the procedure room. Yes.
Well, yeah, it happened in the procedure room.
It started in the procedure room.
Right. Started in the procedure room and carried on to transfer to PACU and on into the PACU, right?
Yes.
And it started, I mean, you're saying not during the procedure.
After
How
the
was-
procedure was complete, that's when she started.
You mean after he pulled the needle out?
Yes. After we put, at the end of the procedure, we put a Band-Aid on and have them roll over to the other bed. The Band-Aid was already on at this point.
Okay. So, and that's something you remember?
Yes, because it's abnormal.
And about how many seconds after you put the Band-Aid on did the decerebrate posturing start?
I can't remember how many seconds, but I didn't notice the posturing until she rolled over onto the stretcher.
Okay. So about how long, well, normally after, in this case, Dr. Lee, takes the needle out,
Yeah,
the procedure's in, right?
right. Yes.
And she's still in the procedure room. You're transferring her to,
Recovery.
what's that?
We're transferring to recovery. Sorry.
Yeah, you put her on a different bed, a stretcher, then you roll her to the recovery room, right?
Correct.
And that's, he takes the needle out, put the Band-Aid on, and you go, right?
Correct.
And so you're saying that he took the needle out, you put the Band-Aid on, and that's when the decerebrate posturing started.
As she was rolling over to the stretcher. Yes.
Okay. So you took the needle out, put the Band-Aid on, you were putting her from the bed where the procedure was to the bed where you take her to the PACU, and that's when the decerebrate posturing started.
Once she moved back onto that stretcher. Yes.
Okay. And that took, you say you don't have any idea how many seconds? It was less than a minute though?
Oh, for sure. Yes.
Okay. So it was a matter of seconds, in other words.
Yes. Yes.
And she was in that condition when she was transferred to PACU, right?
Yes.
And after you transferred her to PACU, was that when Dr. Lee said upload this C-arm picture?
No, he doesn't tell me. He doesn't say upload this C-arm picture. During the procedure, he'll say save that picture,
Okay.
and
So-
I'll save that picture to the USB.
And it was just the one picture he said to save, right?
Yes, that's what he routinely does.
Okay. And do you have any specific recollection of that happening with Arlina Addison in the procedure room? I know you said that's what he typically does, but what I want to know right now is whether you have specific recollection of that conversation occurring while Arlina Addison was undergoing the procedure.
I've done so many, they play in my head. So nothing went abnormal during that time, like picture wise.
Okay. So like, I think when we started, you testified you did not have specific recollection what you recalled specifically was the complication after the procedure, right?
I recall specifically like her coming into the room before the procedure. And like during the procedure, there was no complications. Afterwards, the complications.
All right. And that's what you recall, right?
Yes, that's what I recall.
I'm going to show you what's been previously marked as Exhibit 2 to your deposition.
Okay.
Can you see that all right?
Yes.
And I'm going to enlarge this as best I can. Do you see, you were saying that 1972
Oh, I can't see.
to February 2nd, 1970 overlay is on all the films. Can you show me where it is on this one?
No, I can't even show you where the original timestamp is.
Okay. So you can't see it on this one?
I can't see anything. It's so poor quality.
Okay. Any reason to believe that we were provided false or fraudulent records by OrthoAtlanta Surgery Center, Austell?
No.
Okay. Sometimes the quality is just like this, is that right?
Well, when you take like, that looks like a copy was made, I guess. I can't speak to that, but sometimes the black contrast, maybe, I don't know, but
Okay. I'm going to show you what's been previously marked as Exhibit 3 to your deposition. And this is another C-arm film for Arlina Addison. Can you see this one a little better?
yes, I can.
It's in the upper left, just like that first one on June 9th. It says Arlina Addison, 9206. That's a patient number, right?
Yes,
And it's Dr. Lee, is that right?
yes,
This would have been the extent of the patient input by the nurse or the x-ray tech, right?
looks like that's all I put in. Yes, I don't,
Yes, ma'am. Then down in the lower left and lower right corner, we went over, that's all machine generated, right?
yeah,
And here it says CESI, that stands for cervical epidural steroid injection, right?
yes,
And that's just like the injection that she received on June 9th, 2022, right?
yes,
If you look up here in the upper right corner, do you see again, see where it's OrthoAtlanta?
yes,
See that timestamp 12/15/16?
yes,
See the timestamp 8/25/41?
yes,
And what I'm looking for right now, and I want you to point to me, is that second timestamp that you testified earlier appears on all of these CR pictures.
it's not on
Back to
this
the
picture.
form.
Oh,
Go ahead.
it's not on this picture.
All right, and maybe I misunderstood earlier. I thought you testified that that appeared on all of these. Is
With
that
the
right?
machine I use now, I didn't work here in 2016, so I'm not sure what kind of C-arm equipment they had then. That was, 6 years before this date.
Okay,
Different machines do different things, whatever they're programmed to, so I can't speak to that machine.
okay. Well, I mean, I'm not, here, let me I'm not exactly following you. You see this down here on the left, the OEC?
Yes,
You know these machines are manufactured by GE, is that right?
correct, yes.
And that's the name of the machine, that OEC?
OEC, yes.
Yeah, so that's the same machine, just 6 years earlier than 2022, right?
Object to the form.
I can't speak to that. I don't know what they used in 2016.
Okay. But there's no overlay on this film, right?
Yeah, correct.
Now I'm going to show you what's been previously marked as Exhibit 4 to your deposition. This is another film that was provided to us by OrthoAtlanta. You see that one all right?
Yes.
Here it
Yeah,
is up in the upper left-hand corner again, Arlina Addison, patient number 9206, and Dr. Lee, right?
correct.
Lower left corner, this is CESI, so that's the same procedure, right?
Correct.
Lower right corner, this is also machine generated with the name of the machine, the OEC, right?
Yes.
Then in the upper left, here we've got again OrthoAtlanta, 9/15/16, 7/59/45. You see that?
Yes.
And that's also generated by the machine?
I don't know which machine, but yeah,
Okay. Well, the machine used to take this picture, right?
the machine used to take that picture. Yes.
And again, there's no overlay covering the timestamp on this C-arm picture, right?
Correct. Yes.
And you agree that you're also required to follow the surgery center policies and procedures,
Yes.
and that's to ensure the safety of your patient?
Yes.
I'm going to show you what's been previously marked. I think we're up. Is this 5, Madam Court Reporter?
Yes.
Thank you. I'm going to make Exhibit 5. It's going to be Arlina Addison's medical records that were provided to us, OrthoAtlanta, for June 9, 2022. And we've got an excerpt from those records for you. And I'm going to pull those up.
Are you okay to keep going, or do you want to take a break? No,
Okay.
let's do it. Okay.
What's that?
I just asked her if she was okay to keep going, or if she wanted to take a break before we get into something else. But she
Oh,
said
you wanna
okay
take-
to keep going.
Okay. We can take a break at any time too. If
Okay,
you
I'm good.
Just tell your lawyer, say, that's enough for now. Not a problem.
Okay.
I'll show you what's been previously marked as Exhibit 6, right?
5.
Oh, well, let's see. I think I made let's see, the medical record is 5. This is an excerpt of the medical record, which is 6. Is that right?
Thank you.
Thank you.
Yes, thank you.
So this is again back June 9, 2022. See that? See up here the patient?
Yes.
Patient number 9206. Right?
Mm-hmm.
Yes.
Yes. Sorry. Yes.
That's all right. Of course, she's a female, date of birth 11/28/1971. She was 50 years old. Right?
Yes.
And DOS, that stands for date of service, right?
Date of service. Yes.
That's a June 9, 2022 date that she was your patient in the procedure room, right?
Yes.
From 10:24 to 10:34 that morning.
Yes.
And then you cared for her some afterwards as well, right?
Yes.
That's what these records are for, that date of service, that patient, your role, right?
Yes.
It reads here, this says preoperative information. You see that?
Yes.
It reads transferred within the facility. You see that?
Yes.
And that's talking about a transfer within the OrthoAtlanta Surgery Center Austell facility, right?
To another department. Yes.
Yes, ma'am. And she was transferred from this preoperative department to the operative, the procedure room, right?
Yes.
And the transfer date was June 9, 2022.
Yes.
And the transfer time was at 10:24.
Yes.
And she was transferred via stretcher, right?
Correct. Yes.
And from this pre-op room where she was to the procedure room or operating room where the cervical step epidural steroid injection was performed is only about 6-7 steps, right?
It's probably like more like 30 steps.
30 steps?
Yeah.
So, I mean, 30 steps. So that's probably 50 or 75 feet, something like that.
Yes. It's not far.
Okay. And so this transfer from pre-op to the operative room takes less than a minute, right?
Yes. About a minute.
Okay. And then the transfer, she was transferred by Angela Day and transferred to, that's you, Miranda Dudley, right?
Yes.
And she was transferred to you on 6/9/2022 at 10:24.
Yes.
Okay. That's when she first arrived in the procedure room, right?
Yes.
There are preoperative assessments. You see those?
I see. Yes.
And these are vitals. This helps you establish what's called a baseline for this patient, right?
Correct.
So her blood pressure, her baseline was 102/67, right?
That's what it says. Yes.
Heart rate was 88.
Yes.
Respiratory rate of 16.
Yes.
Oxygen saturation 98.
Yes.
Temperature 98.1.
Yes.
And she was in what's called a semi-Fowler's position. Is that right?
Yeah.
What is
Yes.
semi-Fowler's position?
It's like partially reclined. It's just the position our stretchers mostly stay in.
Yes. And she had already had the procedure site marked by Dr. Lee. Is that right?
Yes.
And then the operative department, that's where you were in the procedure room, right?
Correct, yes.
And the 3 people in the operating room or procedure room were you, Young Lee, the physician, and Emily Doyle. She was the registered nurse. Right?
Correct, yes.
And the time in 10:24 that morning,
Yes,
time out 10:34 that morning.
yes,
And it's got your role as a registered nurse, but your role was the, would you say C-arm tech for that procedure?
yes, tech, yeah,
Okay. Or X-ray tech?
x-ray tech, yes.
X-ray tech. And Emily Doyle's role was, as listed here, the registered nurse, right?
Yes,
She was ensuring that the patient's vitals were stable.
correct, yes,
And the surgeon, Young Lee, MD, was performing the epidural steroid injection.
correct.
And then we've got immediately beneath that, transferred within the facility again, transferred to recovery. You see that?
Yes,
And she was transferred from you to recovery on June 9, 2022 at 10:34, right?
yeah, she never left my care, but yes, that's when we went to recovery.
Yes, ma'am. Well, she was transferred from the procedure room to recovery at 10:34.
Correct, yes,
So her time in the procedure room with the C-arm was from 10:24 to 10:34.
correct.
It reads here, transferred by Emily Doyle, transferred to Miranda Dudley. What you mean there is you stayed with the patient. She did not.
Correct, yes.
And the one reason she was transferred out of the procedure room is because there were other procedures that need to follow hers, right?
Object to the form. You can answer to the extent you know.
I'm not sure if there were or not that day.
What's your understanding about why Arlina Addison was moved when she was suffering from decerebrate posturing and had urinated herself rather than cared for in the procedure room?
There's more staff readily available to help in the recovery room, and you just when something like that's happening, you want all hands on deck. So
Yes, ma'am. And by something like that, you mean
the urinating herself and the posturing.
she required critical care.
She
Object to the
required
form.
she required more care than we could give her in the procedure room.
Okay. And the PACU, that's a post-anesthesia recovery room, right?
Correct, yeah.
You agree, PACU is, I mean, there to assist someone with sedation, right?
Object to the form.
No, they don't give sedation there.
No, they don't. It's post sedation.
Post sedation,
That's why
yeah,
they call it post anesthesia recovery, right?
right.
And that's their role, to assist that patient as the patient's the body's offloading the drugs that were there to sedate the patient, right?
Object to
Correct.
the form.
Oh,
You
sorry.
agree that's not the same as an ICU in a hospital, right?
I agree.
It's not the same as an emergency department in a hospital.
It's not the same in what way?
Well, an emergency department is there to provide emergency care for patients that require it, right?
Yes, and we are trained to provide that care if we need to.
Okay. Tell me all of your emergency care training.
Well, I'm ACLS certified, and that's advanced cardiac life support. So you go through emergency scenarios, how to handle them during, And that's a certification we keep up every 2 years.
Right. And ACLS is designed to help you resuscitate a patient. It's either unable to breathe or unconscious, right?
Whatever the situation may be, if it's helpful with any emergent situation.
Okay. What else?
Training wise,
Yes, ma'am.
just my experiences are in the last 16 years. I've dealt with multiple situations to help with emergencies.
And how much experience do you have in a critical care unit?
I can't put a number to it, but I'm pretty experienced with critical care.
Okay. Uh, where have you worked in a critical care unit?
Within the Baycare Health System, I worked in multiple ICUs. Every night I had a different assignment. Within in Anchorage, within not the native, whatever the HCA hospital is up there, I worked in a critical care unit up there. So on and off throughout my career, I've been in critical care units.
So in critical care unit, ICU, intensive care unit, same thing?
It depends on the hospital, but sometimes CCU is a step down unit, and ICU, it depends on whatever the hospital names that unit. But in Cartersville Medical Center, I worked in their ICU.
What was the level of the ICU in Alaska?
What do you mean the level?
What level of acuity care did they provide? Do you know what I mean by that?
No, it was a trauma center, I'm not sure.
Okay. And what about Cartersville?
Cartersville was also a trauma center, but I don't know, do you mean by like the acuity of the patient?
Yes.
There was high acuity patients on ventilators, and
Mhm.
I don't know if you're looking for a specific, I don't know specifically where you're asking.
And like the training operating the C-arm, you said that was on the job training, is that right?
Yes,
And your ICU and critical care unit training was also on the job training?
yes.
And what about in an emergency department?
I've never been a ER nurse, but I've been down to emergency departments to help.
Okay. In what hospitals did you go down to the emergency department to help?
There's one in Florida called Dunedin Hospital.
You spell that, please?
MEASE, Meese, and then Dunedin, DUNEDIN.
Okay. And when you went down to the ER to help, do you recall what your role was?
Yeah, they called it like a helping hands. I mostly take care of the overflow patients that were waiting to go up to the ICU or go to the floor, or I would draw labs if they needed it, collect specimens, start IVs, that type of work.
All right, so you would draw labs. Is that like drawing blood? Is that right?
Yes, yes,
Like specimens, that would be, for instance, urine.
yes, yeah.
And as far as the overload, you would help with the least acuity patients. Is that right?
Whatever patients they had in overflow, but sometimes they were high acuity, they were waiting on ICU beds.
Okay. And you would work with an emergency physician?
There would be like multiple physicians and PAs down there, yeah.
And at least one of which would have training in emergency medicine, right?
Yes.
Okay. And you don't have any specific training in emergency medicine, right?
No, just on the job experience.
Yes, ma'am. Same for intensive care or critical care. You have on-the-job training, but no specific training in critical care medicine, right?
Usually that is the training. It's like a preceptorship you have to do, and you do classes for it and with that specific hospital system.
Yes, ma'am. And your ACLS that you have to renew every year, how many days is that training?
Initially, it depends on where you get it from, but like initial, when you first get it, it could be a couple days, but when you renew online now, so it usually just takes a couple hours to do it. The actual course.
And how long ago was it when you did the 2-day course?
Oh, the 2-day course?
Yes, ma'am.
So when I started with Baycare Health System, they made me do that 2-day course again since I was an employee of the hospital. I mean, so that's been probably like 10 years ago.
Okay. And back to the medical record, which I believe is your portion or an excerpt with.
Okay.
Right now I'm on page, let's see, page 21 of 33. Do you see that?
Yes.
It reads operative nursing notes, Emily Doyle, that's you, right?
No.
I'm sorry, Miranda Dudley.
Yes.
Documented by Miranda Dudley, 6/9/2022 at 13:30, that's you, right?
Yes.
That's 1:30 in the afternoon.
Yes.
And by now, Arlina Addison has already been transferred to the hospital
Yes.
by ambulance.
Yes.
And it reads procedure complete and needle out at 10:31.
Yes.
And by needle out, you mean
His
that's
procedure
what-
needed Dr. Lee.
yeah, Dr. Lee took the needle out at 10:31, right?
Mhm. Yes.
And you applied a Band-Aid, and within seconds, Arlina Addison began the decerebral posturing, right?
Yes.
And then a Band-Aid was applied, as you said, to the injection site, right?
Yes.
And the patient started to complain of her legs shaking.
Yes.
Patient then became tachypnic, right?
Correct.
What is tachypnea?
Fast-paced breathing.
And you recorded her respiratory rate, right?
Probably when we got to recovery.
These are, I'm going to scroll down because these are in reverse chronological order. And it
Yeah.
looks like you agree when you take measurements, you're required to date and time those, right?
Correct. Yes.
And that's again for patient safety, patient care, right?
Object to the form.
You may answer.
For accurate patient charting. Yes.
Well, and that accurate patient charting is important for the safety of your patient, right?
Object to the form. Cancel.
I don't see those two as correlating, but
Really? You think of the 182 over 106 blood pressure and a heart rate of 165, you think if that was taken 20 minutes later, it wouldn't make a difference for the care of your patient?
I agree that accurate charting is something that's mandatory, but
It's mandatory for the safety of your patient, right?
Same objection. Cancel.
I take care of the patient in the moment. You don't chart in real time. You just tend to the patient.
Thank you. Answered that question. My question's a little different. Madam Court Reporter, would you please read back my question?
It's mandatory for the safety of your patient, right?
Same objection. You can answer.
I don't think it would put the patient as being unsafe. I'm just confused at what you're asking. Sorry.
Sure. You agree that when you perform when you check your patient's heart rate, you have to note the date and the time of that
Yes.
test. Same thing for blood pressure, right?
Yes.
And when you're charting for a patient, you're required when you observe, signs or symptoms to chart the date and the time that you observe those signs and symptoms, right?
Correct. You want to be as accurate as possible.
Yeah, and that's important because if a patient's, is having a number of, has this constellation of signs and symptoms all at one time versus one an hour before, one now, and one 2 hours later, that's totally different, right?
Yes,
And for a physician, for instance, that's looking at a chart when you're not there for your patient, it's important that those times be accurate, right?
yes,
So when you took Arlina Addison's blood pressure, you timed when you took it, right?
yes,
And that was at 10:36 that morning, right?
yes,
And you already had a baseline for Arlina Addison from the preoperative notes, right?
correct, yes,
And if we go back up, you see the preoperative is 102/67, the blood pressure.
correct, yeah,
And the preoperative or heart rate is 88, right?
correct, yes,
So those are your baselines for this patient.
yes,
Your baseline respiratory rate is 16, right?
correct,
And then we scroll back down to 10:36 when you recorded these vital signs. These are all called vital signs, right?
yes,
The patient's heart rate had gone from 88 to 165, right?
correct, yes,
That's nearly double, right?
yes,
And that's disconcerting for you as a healthcare provider.
yes,
When your patient's heart rate goes from 88 to 165, you know you've got a problem.
Object to the form.
The answer.
it's not normal,
It's abnormal.
it's abnormal, yes,
And it's not abnormal by 10 or 20 points. It's abnormal by about 80 points, right?
yes, that's abnormal,
Well, it's nearly double her heart rate.
right,
And based on your education, training, and experience, when a patient's heart rate doubles, that creates concern, right?
yes,
Object to the form.
That alone would create concern for you because you want your patient to be safe.
correct, yes,
And the same thing when a blood pressure goes from a baseline of 102/67 to 182/106, that creates a concern for you, right?
yes,
A concern for your patient.
correct, yes,
And you agree that blood pressure of 182/106 is a dangerous blood pressure, right?
Object to the form.
You may answer.
it's abnormal,
But it's also dangerous for your patient, 182/106.
Same objection. I'm just gonna object to the extent that calls for speculation and lack of foundation. If you're asking her based on her nursing experience, then she can answer.
I need a timestamp on that, please, Karen. And I object to any speaking objections. You may answer.
It's not a speaking objection. We did not reserve objections. So I need to perfect
Answer.
the record and make whatever objections I need to make.
You may answer.
if that's dangerous,
Yes.
I don't consider it dangerous. She has healthcare professionals all around her tending to her. It's up to the doctor taking care of her. I can't say if that's dangerous or not.
Oh, that's fine. So your testimony is her heart rate going from, I'm sorry, her blood pressure going from 102/67 to 182/106 is not dangerous. Is that your
It's
testimony?
very
Same
concerning.
objection.
It's what?
It's very concerning, I would say. I don't like the word dangerous because I would never say someone's in a dangerous situation under healthcare, but it's concerning.
So it's concerning, but not dangerous, right?
Object to the form. This has been asked and answered.
You may answer.
Answer one more time.
I wouldn't consider it dangerous, no.
And the same thing for a heart rate in this patient that went from 88, and for the record, we're looking at page 12 of 33. For a heart rate that went from 88 to 165 is also not dangerous for your patient, right?
Same objection.
I would not use the word dangerous, correct.
What word would you use?
Concerning,
So the heart rate near doubling would be concerning by itself, right?
yes,
The increase in blood pressure to 182 over 106 would be concerning by itself, right?
yes,
Increase in a heart rate to 165 and an increase in blood pressure to 182 over 106 together would be even more concerning, right?
yes,
And you would consider your patient to be in danger then, right?
Object to the form, same objections as stated earlier.
no, I would not consider them to be in danger.
Okay. And then the respiratory rate, we have a baseline for that too, right?
Yes,
Okay. And the baseline for this patient is 16, right?
correct.
And that's a normal respiratory rate.
It is, yes,
And her respiratory rate went from 16 to 36. Right? That's over doubled, right?
yes, yes,
And that would create concern for you too,
of course.
with the safety of your patient.
Same objection. You can answer to the
Answer.
extent that you can.
I would not be concerned about the patient's safety, no.
Okay. And do you know what sinus tachycardia is?
Yes,
What is sinus tachycardia?
it's an elevated regular rhythm above a 100.
And if you've got a heart rate of 165 and sinus tachycardia, a respiratory rate of 36, and a blood pressure of 182 over 106, you want to know what's going on with that patient's heart, right?
Object to the form.
Not their heart specifically.
Well, what does an EKG do?
It just tells the rhythm of the heart.
Just the rhythm?
No, it can tell you if the patient has like any abnormalities, but there's different kinds of EKGs. There's like a 12 lead EKG. There's just like a regular strip rhythm, which that's what we do on the machines.
So as far as wanting information about the patient's heart, you're not capable in the OrthoAtlanta Surgery Center Austell PACU to do the same thing that can be done in an emergency department or a critical care unit of a hospital, right?
As far as like diagnosing or treating,
No, you don't get the same strip that they can get in an emergency department, do you?
we can, yes.
You said you have a 12 lead there then.
Yes, we do have a 12 lead EKG.
So, but you couldn't hook her up because she was shaking.
Correct, yeah.
And you couldn't check her oxygen saturation because her fists were clenched too tight, right?
Yes, it causes artifact, which leads for it not to pick up like an oxygen.
And then her blood pressure, heart rate, and respiratory rate, you check it again 5 minutes later, is that right? 10:41?
That's when it's documented, but she was under continuous monitoring.
Yes, ma'am. My question was a little different.
Okay.
So you're saying you didn't check it again, you just recorded it at 10:41.
I recorded it, yes.
Okay. And in order to record it, you checked it, right?
I wrote down what the vitals were at 10:41, yes.
And her heart rate was now 148.
Yes,
Still concerning,
still concerning, yes.
not dangerous though.
Not dangerous, no.
Respiratory rate of 30, O2 sats of 86. Is that right?
Yes,
That's also an issue, right?
yes,
Also concerning, right?
yes,
Blood pressure of 167/98, also concerning.
correct, yes.
What is the lowest you would like to see a patient's oxygen saturation?
You want to see somebody 92 and above.
92?
92% and above in a normal situation, yes.
Where would you, I would like for you to cite for me any treatise, any chapter in a treatise, any textbook, any chapter in a textbook, any peer-reviewed article, non-peer-reviewed article, grand rounds, throwaways, anything in medical or nursing literature that says that a healthcare provider is okay with a patient's oxygen saturation of 92.
So it's object to the form of the question to the extent that that calls for an expert opinion. I believe that we've responded to her deposition notice to state that she has not done any research in preparation for her deposition. So, I mean, to the extent that she knows as she's sitting here, she can answer.
I'm going to object to the speaking objection. Madam Court Reporter, I need this timed. If you do it again, we're filing a motion.
It is not a speaking objection.
I will let the judge decide. I
Reserve
will be
objection.
filing a motion. You may answer the question. Would
I
you like
cannot
the court
cite
to read it
anything.
back?
No, I can't cite any literature.
Okay. Well, tell me, did someone at OrthoAtlanta Surgery Center, Austell, tell you that as long as the patient's oxygen saturation was 92 or above, there was no need for concern?
No,
Where did you get that number?
it's just knowledge I've gained over the years.
The same on-the-job training that you use when you run the C-arm or work for overflow in an ER?
Yes, everything is patient specific.
But you're saying the 92 is patient specific?
It is, yes. There's some patients who walk around with an oxygen rate of 88 and that's their normal. It just depends on the patient.
And cite for me any literature in the history of medicine or nursing that says 88 is a normal oxygen saturation, right?
I can't cite anything.
Okay. But based on your experience and on-the-job training, 88 is also okay, right?
It depends on the patient.
Well, if you said that was normal, why would it depend on the patient?
I said it's patient specific.
Well, if somebody had a blood pressure of 120/80, that would be patient specific, but it wouldn't matter what patient it was. That's a normal value, right?
120/80, blood pressure is a normal value, yes.
Right. And what you testified to was that an oxygen saturation of 88 is also a normal value. So why would it matter what patient we're talking
I
about?
said it's patient specific. For a normal value can be varied by patient.
Well, you told me 88 was a normal value and 92 was a normal value.
It depends on the patient. Yes, those both can be normal values.
Okay. Well, and 120/80 is also a normal value, right?
Yes,
Okay. And that is also patient dependent?
it can be whatever the patient normally runs. It just depends on the patient. Everybody has different comorbidities, diseases, so not everybody's the same.
Okay. So the oxygen saturation of 88 would not concern you, right? Or 86 would not concern you, right?
Depending on the patient, if this patient in particular, yes, at 86% oxygen rate is concerning.
Okay, but an 88's not.
For this specific patient, if her oxygen was 88, yes, that would be concerning.
And 92.
92 is not concerning.
Okay. And her blood pressure, the next reading you take is at 10:51. This is 10 minutes later, right?
That's the next one I recorded, yes.
The blood pressure is now 163/122, heart rate 120, respiratory rate of 41. Is that right?
Yes,
So now her breathing, the respiratory rate's gone up to 41. Heart rate's gone down to 120. Blood pressure still elevated at 163/122, right?
yes.
And what do those signs taken together, this constellation of signs and symptoms, tell you?
As a
Right.
nurse,
As a
correct?
nurse,
Yep.
that something underlying is causing elevated pulse rate, an elevated respiratory rate, and an elevated blood pressure.
Okay. When you assess a patient, you don't diagnose patients, but as a nurse, you still assess patients, right?
Correct, yes.
And you take into account the entire constellation of signs and symptoms in this patient, right?
Correct, yes.
So in addition to these things and the loss of bladder control and the decerebrate posturing, what was your nursing assessment based on that constellation of signs and symptoms?
My nursing assessment based on that is get her out to recovery, get her stabilized. I can't diagnose her or say there was an issue, but there is definitely something from the normal happening that we needed to take care of.
Do you remember calling 911?
Yes,
Do you remember what time you called 911?
I don't remember specifically, no.
Okay. And then you continue to record her vital signs. I think the last one that you recorded was at 11:21, is that right?
That's the last one recorded, yes.
And from 10:34 to 11:21 is 47 minutes, is that right?
Yes,
Back to your nursing notes. This
Uh-huh.
is a nursing note at 14:19 or 2:19 that afternoon. Unable to get accurate pulse ox reading due to clenching fist and rigidity. Do you recall that?
yes,
And that, have you ever seen a patient before Arlina Addison suffered from decerebrate posturing?
many times, yes.
Okay. There at OrthoAtlanta?
No, not at OrthoAtlanta, in the hospital.
Okay. In a critical care setting?
In an acute care setting, in the hospital, like I've seen it on the floors and in the ICU, yes,
Did those patients survive?
yes,
Do you agree decerebrate posturing is a sign or symptom, depending on whether you observe it or someone tells you about it, of a brain injury?
Object to the form, lack of foundation.
You may answer.
I'm not necessarily a brain injury. I've seen it in people having seizures
Okay, where do seizures originate?
in the brain.
So you're saying, it's your understanding decerebrate posturing is not indicative of a brain injury?
Same objection.
I can't speak to that. I'm not a doctor.
Okay. Well, you've observed decerebrate posturing as a nurse, right?
Correct, yes,
And you have to make a nursing assessment based on that observation, those signs, right?
yes,
And so you would assess and say decerebrate posturing, and you wouldn't make any assessment as far as, you know, what was causing or contributing to the decerebrate posturing. Is that right?
I would work with a physician to try to figure out what was causing it. I wouldn't diagnose them as like what caused it.
Okay. So you don't know whether decerebrate posturing is a sign of a brain injury in a patient? One
It
way.
could be a sign, yes.
Clenching of fist and rigidity. So you've seen that before. Never
Yeah.
at OrthoAtlanta though.
No, never here, but like in the hospital, I've seen it. Yeah.
In acute care patients.
Yes.
Okay. And have at OrthoAtlanta Surgery Center, Austell, have you ever, before Arlina Addison called 911 and had to refer a patient, had to have someone transported to the emergency department?
Yes.
Okay. And how often did that happen?
It's not a common occurrence. I can't speak to a number, but it's not even on a weekly basis. It's not common.
Okay. On average, you would say what, once every 6 months?
Yes. Maybe once every 6 months, maybe twice. I can't speak. It's not common.
So on average, a couple of times a year, 2 or 3 times a year, maybe.
Yeah, maybe a little bit more.
Okay, 2 to 4 times
Yeah.
is as an estimate, right?
As an estimate, yeah.
And have you ever had someone who was referred to the emergency department as a result of what happened and during or immediately after a cervical epidural steroid injection?
No.
Okay, that's the first time.
Yes. For me
But-
here, yes.
For you, yeah. Attempted to get EKG, unable to due to artifact from shaking. And why did you want an EKG?
Maybe to see why her heart rate was elevated, to see if she was like in an irregular rhythm. It's one of the tools that we use to try to figure out what's going on.
Right. Dr. Lee advised to call EMS. EMS called at 10:47. You see that?
Yes.
And patient still unable to, is that FOC, is that follow commands or?
Yes, sorry, it's follow commands, yes.
I've never seen that before.
Sorry.
That's all right. The patient still unable to follow commands at 10:47. Is that right?
Yes,
So that's now the decerebrate posturing you've now observed from 10:31 to 10:47. So about 16 minutes. Is that right?
for the posturing, no.
No? How long?
I'm not sure how long she postured for, but she did not posture for that whole time.
Well, at 10:47,
The follow command is more of like a orientation type assessment. It's not like saying she couldn't move her extremities. She just couldn't follow the command she was told.
this is your note though, right?
Yeah, that's my note.
You made it on June 9th, 2022 at 14:19.
Yes,
So shortly after the procedure.
yes,
You see this where it reads 10:52. This is now 18 minutes, right? Or if it was 10:31, 21 minutes. Is that right? 10:52?
yes,
10:52, patient still exhibiting rigid position and shaking. Do you see that?
yeah.
The rigid position, that's the decerebrate posturing, right?
No,
Oh, okay. What did you mean by rigid positioning?
just like her hands were rigid, her muscles, like not the posturing, but she's just tense, more like tense.
What I see is rigid position.
Correct, yes.
Okay. So she was still exhibiting a rigid position, but it was somehow different from the decerebrate posturing, right?
Correct, yes.
So tell me how the rigid position was different from the decerebrate posturing.
It's almost like a clenching, like she was sitting up at that time. It's not that posturing with the hands out and stuff. It's like a clenching, like tense muscles,
Okay.
like muscle rigidity, but not posturing.
And at 10:52, she's still shaking. And but now she's able to answer yes, no questions and states her legs are tingling, right?
Correct, yes.
So 1052 is when you noticed a change in her condition, right?
Check to the form.
What do you mean a change?
Well, 1052, she's still exhibiting rigid posture and shaking, but now she's able to answer yes, no questions, right?
Yes,
Driver Shay notified of pending transport by Dr. Lee, and daughter Hillary called and notified of patient status. EMS arrived 11:08. Is that right?
yes,
Report given, patient awake and able to
follow commands.
follow commands. All right. At this time, refuses to go with EMS, but states legs are tingling still. Dr. Lee at bedside to speak with patient. Patient agrees to be transported to Cobb Hospital after speaking with Dr. Lee and transported by EMS at 11:30, right?
Yes,
11:30 is from 11:34, that's about 56 minutes. Is that right?
correct, yes.
And 11:30 from 11:31 is about an hour, 59 minutes, right?
From when?
From the I'm sorry, 10:31 to 11:30 is about 59 minutes when you made the 10:31 note, right?
Yes.
All right, it's 1 o'clock. We'll take a short break. Do you want to go to lunch now or do you want to give a preference?
No,
Why
I
don't
don't
we-
have a preference.
Why don't we break for lunch and come back at 2?
Okay,
That sound good? You all
Yes.
right with that, Ms. Godsey?
Yeah, that's fine. Whatever, I mean, it's up to her, whatever she wants. So,
Okay, I'll see you shortly.
all
Thank you.
right.
thanks. Make sure I have my
Bless
phone
you.
on.
Bless you, or is right for that or not, but.
Miss Beckett, are you there?
I'm here.
You let me know when you're ready, Miss Dudley, and we'll start by.
I'm ready.
All right. I'm uploading Exhibit 7.
911, what's the location of your emergency?
Um,
OrthoAtlanta Surgery Center of Austell. What's the address? 3672 Marathon Circle, Suite 120.
Exhibit 7 is the 911 call you made. Madam Court Reporter, if you can take this down, I'd like for you to do that.
Okay,
Thank you. And I'm going to play this call for you, Ms. Dudley, and I'd like to then ask you a couple of questions about it. What
Okay.
I want you to do before I play it is listen to it and let me know whether that's you making a call on June 9th, 2022 regarding Miss Addison. All
Okay.
right? I'll go ahead and show it to you.
What's the location of your emergency? OrthoAtlanta Surgery Center of Austell. What's the address? 3672 Marathon Circle, Suite 120. I'll repeat that to make sure I have it correct. 3672 Marathon Circle, Suite 120. And what was the name of the business? OrthoAtlanta Surgery Center. What's your name? Miranda. And what's the number you're calling me from, Miranda? 678-945-8520. Tell me exactly what happened. We're a procedural center. We did a steroid injection. We need a patient transferred to Cobb. She's just having a bad reaction, convulsing. We can't get her to stop. So, okay, stay on the phone with me. I'm gonna have a few more questions for you. Are you with her right now? Yes. How old is she? Fighter. Sorry. And is she awake? She is awake, yes. And is she breathing? She is breathing, yes. Was the patient seen by a nurse or doctor in the last 2 hours? Yes, there's an anesthesiologist at the bedside. And will the crew need to administer or monitor any medications? No. And will any special equipment be necessary? No. And will additional personnel be necessary? No. Okay, help is on the way as requested. Please have any advance directives ready for the paramedics, and if she gets worse in any way, call us back immediately, okay? Okay, thank you. You're welcome, bye-bye.
Was that you?
Yes, that was me.
You at 911 and you on a 911 call?
Yes.
And that was regarding Arlina Addison.
Yes.
And that call took place on June 9th, 2022.
Yes.
I'm going to show you what's been previously marked. Is this 8? Let's see, 2, 4.
yes.
Thank you. And do you have any X-ray techs at Atlanta Ortho Surgery Center, Austell?
We do not have any radiology techs.
Okay. Is that what you call them instead of X-ray techs?
Yeah. They go to radiology school for it.
Right. Did you have any in 2022?
To the best of my knowledge, nobody had any, went to radiology school during that time.
And you weren't certified for that, right?
I did not attend school for that, yeah.
Okay. So you had no radiology techs in 2022
To the best of my knowledge, yeah, we didn't have any.
and none in June 2022.
Correct, yeah.
Like you, they would have nurses cover for that. Is that right? Handle
We
that.
had our surgical technologists would cover for that too. They did the safety training and hands-on experience.
Okay. All right, I'll show you what's been previously marked as Exhibit 8. Oh. Not it. This is the 911 call incident
Mhm.
report. Have you ever seen this document before?
I have not.
Okay. There's an incident number CF 2022-69. That's when it happened, June 9, 2022, right?
Right.
And it looks like an incident number 000-34376. Those numbers don't mean anything to you, right?
No, yeah, they don't.
And the location, the address for the Atlanta Ortho Surgery Center, Austell, is 3672 Marathon Circle Southwest, right?
To the best of my knowledge is a 3672 Marathon Circle Suite 120. I don't know where the Southwest came from.
Okay. But that's otherwise the correct address. 3672 Marathon Circle is the address, right?
Yes, yes,
And that's in Austell, Georgia.
yes.
And the city, CC, do you know what that means?
No.
Okay.
Maybe they meant Cobb County? I'm not sure.
Okay. And then it was created 10/44/38/6/9/2022. Do you see that?
I see that, yeah.
And that was the time you made the call at 10:44 that morning?
If that's what they recorded.
Yes, ma'am. Sounds right to you, right?
Yeah,
And that was again on June 9, 2022.
yes.
And a priority one, do you know what that means? Priority one?
Just, I don't know what it means in their terms, no.
What does it mean in your terms?
I would think that would mean highest one.
And what does EAMBU mean?
Emergency ambulatory? I don't know.
Like an emergency ambulance, maybe?
Yeah,
Okay. And you see here under comments again, 10/44/38/6/9/2022, OrthoAtlanta Surgery Center. That's where you were, right?
yes,
It reads patient having a bad reaction and convulsing. Is that right?
yes,
And that's what you shared with the operator.
yes,
And you also, in addition to bad reaction, you told her we can't get her to stop, right?
correct, yes,
And that was as of at least 10/44/38, right?
yes,
When you made the call, you weren't able to get her to stop the decerebrate posturing and
the
convulsing,
convulsing.
right? And it's interfacility. I suppose that's because you're a surgery center.
I guess, I'm not
Yeah,
sure.
if you don't know, just tell me you don't know. You don't know.
I don't know, I don't know.
Transfer 50-year-old female, conscious and breathing. Is that right?
Yes,
Dispatch level, emergency response. You see that?
yes,
So they came with sirens and all that stuff, right?
yes,
No specific condition identified. Seen by a nurse or doctor within the last 2 hours. She asked you that question, you answered that. no additional personnel needed. Is that right?
Correct.
And it's got the name here, Miranda, and that's the name you gave her on the call.
Yes.
And this is the number you use, 678-945-8520.
Yes.
That's the number you shared with me earlier today as being an OrthoAtlanta cell number that they'd given you, right?
No.
Okay. Maybe I misunderstood. There was an app.
Yes. That number is 678-945-8524.
Ah, okay. Thank you. So
Yes.
you were calling from a different number?
Yes, from the desk phone,
Ah,
didn't
okay.
hack you.
Got it. And we were talking about other emergency calls. Looks like on June 8th, 2022, which is just the day before this call, there was another 911 call. Is that right?
That's what it says.
Were you there that day?
I'm sure I was. I don't remember that call.
Okay. You don't have any idea why 911 was also called from the Atlanta Ortho Surgery Center, Austell, the day before on,
Not
You-
without viewing patient records.
okay, not without what?
Not without being able to go look at patient records from that day. I can't speak to it.
Okay. Now, do you recall also speaking with the daughter, Hillary?
Yes.
And do you recall her trying to get information about her mother?
No, I called her to inform her that we were going to send her mom out by EMS.
Okay, tell me everything you recall about your conversation with Miss Addison's daughter, Hillary, on June 9th, 2022.
I just remember calling her to tell her that we were going to send her mom out by EMS and that her mom was at that point in stable condition. EMS was on the way. But I just remember her being very defensive, like she wanted to come up there. That's all I remember.
You said she would not come up there?
She wanted to, like,
Wanted to come up there.
yes.
What else you recall about that telephone call?
That's all I remember.
I'm going to show you what's been marked as, let's see, number 9. Do you recall telling Hillary that her mother was still suffering from seizures when you first spoke with her?
I don't recall exactly.
Yeah. To show you what's been previously marked as, what did I say, Madam Court Reporter, 10, I think?
9.
Thank you. Can you see that all right?
I can see that, yeah.
And this is the incident report that we were talking about earlier, right?
Yeah, I don't remember did we talk about it?
I thought so, a little bit,
Okay, yeah,
and maybe not. This is the OrthoAtlanta Surgery Center Austell incident report regarding Arlina Addison. Do you see that?
yes,
And date of service June 9, 2022, right?
yes,
Lee Young, physician. Is that right?
yes,
And did you participate in the preparation of this incident report?
yes, I wrote it.
Okay. And did Dr. Lee and Angela Day also participate in the preparation of this incident report?
No,
Okay. Who participated along with you?
just me.
Okay. So you wrote this June 9, 2022 at 10:32 that morning? That
No,
was
that's the time of the incident.
okay. And that was a Thursday?
Yes.
And you've got patient circled. Does that mean that the patient was involved?
No, it just kind of delegates who the incident report is concerning, like a patient, a visitor, you know.
Mhm. Did you meet with anyone before you prepared this incident report?
No.
Okay, you just prepared it. That's part of
Yeah,
your, all right. And it involved a patient, maybe that's why the patient circled.
correct. Yes.
And the patient was a female.
Yes.
Admitting diagnosis was cervical radiculopathy.
Yes.
That's why she received the cervical epidural at C6, C7, right?
Correct. Yeah.
Brief description, this is your description.
Yes.
Procedure C67 midline ESI, that's a epidural steroid injection, right?
Yes. Mhm.
It says, does that say medicine, 3 milligrams of Versed?
It says procedure meds dash 3 milligrams of
gotcha.
Versed, 50 mics of fentanyl.
Thank you. Procedure meds, 3 milligrams of Versed and 50 micrograms of fentanyl, right?
Correct. Yes.
You received both those.
Yes.
Patient became rigid. You see rigid?
Yes.
Tachypnic,
Yes.
tachycardic,
Yes.
and was unable to FOC follow commands approximately 20 minutes following ESI. Do you see that?
Yes.
And the rigid, you would characterize the signs that you observed as decerebrate posturing, right?
Yes.
You agree with Dr. Lee when he wrote
Yes.
decerebrate posturing. Yeah. And eventually was able to follow commands, but still complained of leg tingling and PACU. EMS called and transferred to Cobb Hospital, right?
Yeah.
In the EMS call, we just listened to that. Is that right?
Correct. Yes.
No, apologize. No other EMS calls that you're aware of, right?
Correct. Yeah. No, no other.
And see chart for description. That's the description.
For like for further details.
Right. And that's the extent of the brief description in the incident report, right?
Correct. Yeah.
Location of incident, patient family aware of incident. Yes, you'd spoken with Hillary, right?
Correct.
You've told me everything you remember about that call, right?
Yes.
It reads unplanned acute care transfer.
Correct.
And acute care means what?
Acute care, hospital setting.
Yes, ma'am. Acute care, critical care, same thing.
No.
Okay, what's the difference?
Acute care patient can mean a med surg patient or a critical care patient. Just an
Okay,
acute care setting is just a hospital setting.
okay. This patient needs attention in a hospital setting, right?
Correct, yes.
The next thing that's marked, medical treatment, emergency room, that's where she's being sent, right?
Yes, uh-huh,
For a higher level of care.
correct.
Nature of injury sustained, unable to determine. Is that right?
Correct.
You didn't know what was going on. You observed signs, but you weren't able to assess or diagnose her condition, right?
True, yes,
Another reason she was being transferred to the emergency department.
correct, yes.
Then you've got severity level here, and she was a level 4.
Yes,
Major injury. You agree she had a major injury?
no,
Incident is potential life-threatening. You agree she had an incident that was potentially life-threatening?
no,
You agree that immediate physician or nursing intervention was required?
yes,
So you circled level 4, but her incident was not potentially life-threatening?
I can't speak to that. I didn't consider her condition life-threatening, no.
Well, you circled level 4, right?
Yes,
And you circled level 4 at around 11:30 on the morning of June 9th, right?
I'm not sure what time I completed the incident report.
It's in there. We'll get to that.
Okay,
But now you've since, after OrthoAtlanta, Surgery Center Austell, and Dr. Lee have been sued, now your testimony under oath that it was not a major injury and that her incident was not potentially life-threatening. Is that right?
Form argumentative.
You may answer.
the reason I circled level 4, the way I see this form is it's multiple choice. It could be a major injury or an incident that's potentially life-threatening or a patient needing immediate physician or nursing intervention. So the
Mhm.
immediate physician or nursing intervention is why I circled level 4.
Yeah, I don't see an or there though. Do you? Level 4?
No,
Okay. So you just put the or in there now?
no, I'm just telling you my reasoning behind circling level 4. That's my reasoning.
Okay, because it could have been a major injury or incident is potentially life-threatening or immediate physician or nursing intervention.
Yes, it's between no intervention or death. So that's why I circled 4.
What do you mean no intervention or death?
Level 3 is no, like it's not immediate physician or intervention. That's kind of like downplaying it. And then level 5 is death. So this fell in the middle of that.
Okay. Any other reasons you checked level 4?
No, just immediate physician or nursing intervention. That's it.
Witness, that's you, M. Dudley, RN, and Emily Doyle, RN.
Yes.
Angela Day did not participate in the completion of this incident report.
No.
Did you know Angela Day to be truthful?
As far as I know,
Yeah. Any reason for her to lie under oath about Arlina Addison for this case?
no reason.
Well, why do you think she would testify under oath under penalty of perjury that she participated in the preparation of this incident report if, according to your testimony, she did not?
Maybe she has a different recollection than me. I'm not sure.
Okay. Any other reason?
No, no other reason.
And Emily Doyle, she didn't participate either. Is that right?
No.
Right. The name of the physician is Dr. Lee. He was also a witness. Is that right?
Yes.
Employee preparing report, Miranda Dudley. That's your signature, RN.
Yes.
And it says here that you prepared this report at 11:30 that morning, right?
So it says, yes,
And that was accurate when you wrote it that morning, right?
yes. If I wrote that, then yes,
Yes. Ma'am. So any notes that you wrote after 11:30, you would already have completed the incident report. Is that right?
what do you mean?
I mean, if you wrote a note at 11:31, 11:41, 11:46, 11:51, those notes, those recordings in the medical record would have been after you completed the incident report.
Yes,
Okay. Physician's orders. This was at 10:50 that morning, June 9, 2022. I guess this is Dr. Young. Do you recognize his signature?
yes,
10:50 that morning, he orders three things. One, transfer to emergency room. Two, continued supplemental oxygen. Three, continuous monitoring of vitals. Do you see that?
yes,
I notice that in your notes, and we'll have another look at those, that the patient, you were taking vitals when the patient was on room air, right?
correct. When our oxygen level came back up to normal.
Okay. And is that what you thought Dr. Lee meant when he ordered continuous supplemental oxygen?
Within reason of care.
Okay. And the reason of care, if her oxygen saturation came back up to normal, which you would consider what, 92 normal, you would discontinue the oxygen.
If our oxygen was back up to normal, yes, I would discontinue it.
And by normal, well, it doesn't say normal or abnormal on the machine. It says a number, right? From 0 to 100.
Correct, yes.
And your normal is 92, right?
Yes, I mean, 92 to 100, there's a range.
Yeah, but 92 is normal. You would remove the oxygen at 92.
No, not necessarily. It depends on the patient's condition. If she's showing other signs, I would leave it on still.
And that's the same for 86. I think you said in some patients, 86 was a normal oxygen
If they
saturation.
have severe COPD, yes.
Okay. Well, according to the medical record and her history, Arlina Addison did not have COPD at all, much less
Correct, yes.
COPD, right?
Correct,
So you agree 86 would not be normal for her, right?
correct, yes.
But you did testify earlier that 92 would be normal.
It would be the low end of the normal range, yes.
Okay. And you have no authority. I asked you about textbooks, treatises, peer-reviewed articles, anything in the history of just your
Just hands-on experience, yes.
hands-on experience. All right. And Dr. Lee signed that note on June 9th at 10:50 that morning.
Yes,
And it looks like the next page, 1110 EMS here. You see that?
yes,
And does that indicate to you that EMS arrived at 1110 that morning?
that's my handwriting, yes.
Tertiary care, unplanned admission. What is tertiary care?
A third level of care.
Yes, ma'am. It would
It's
include.
going outside of our, like outside of our ambulatory center, so a higher level tertiary care.
Right. And that was again June 9th. You completed this, right?
Yes,
This is.
the transfer record.
Signature. Okay, but you completed it.
Yes,
Again, the doctor is Lee, Arlina Addison, and you wrote here rigidity, seizure-like activity. Do you see that?
yes,
That's what you wrote?
yes,
And that's because that's what you observed.
yes.
Then we've got a nurse report sheet. You completed that as well?
Yes,
And the nurse report sheet, 6/9/22. This is again for Arlina Addison.
yes,
I'm looking for a time on that note. Do you see here where it reads Tom?
Yeah,
Remember talking about the importance of timing a medical record?
Turn to the form.
You may answer.
I remember talking about it, yes.
Yes, ma'am. I don't see a time on this note. Did you time that note?
If there's no time, then no, I did not.
Okay. And what was the reason you didn't time the note?
I was probably I'm getting all the paperwork ready for her to be transferred, so it's just, I forgot to put the time on there. There's
Okay.
a lot happening at that time.
All right. Did you send the incident report along with the ambulance?
No, incident report is not part of the patient's medical record.
It reads current medications, albuterol, Valium, cyclosporin, Elavil, Lexapro, Allegra, hydrocodone, Amitiza, Mobic, Robaxin, Phenergan, and Valtrex. Is that right?
Yes,
Procedures C67 midline ESI. Yes, you
Yes.
wrote all this. Surgeon Dr. Lee, IV site, 22 gauge left hand. Is that right?
yes,
IVF solutions, LR 1000 ml, lactate ringers, I assume you mean. Is that right?
yes,
1,000 milliliters. Medication received prior to transfer, 3 milligrams of Versed, 50 micrograms of fentanyl, procedural meds, IV left wrist. Is that right?
that's LR still.
Oh, lactated ringer still.
Yes,
So there were meds she received other than the Versed and the fentanyl, right?
not that I recall, just the lactated ringers.
You don't remember whether Dr. Lee injected any
Oh,
medication?
during the procedure, yes.
Yeah. Do you remember what it was?
Dexamethasone,
Okay. And what is that?
it's a steroid.
Do you know how dexamethasone, if you inject it into the cerebral spinal fluid, how it would react with the brain?
No,
This is the only time that's ever happened in your memory, right?
that what's ever happened.
That drugs have been injected into the patient's cerebral spinal fluid.
I can't
Object
speak
to
to
the
that. I don't know where it was. I don't control the needle, so
You would defer to the physicians at the hospital who diagnosed her condition, right?
yes,
And the cause of her condition.
yes,
Reason for transfer, seizure-like activity. This is what you wrote, right?
correct.
Seizure-like activity noted, loss of bladder function, tachycardia, left side mouth drooping. That's what you wrote.
That's what I wrote, yes.
So in addition to the signs and symptoms we covered earlier, she also had a droop to the left side of her mouth. Is that right?
If that's what I wrote, yes.
And that's indicative of what?
Object to lack of foundation. You can answer to the extent you know as a nurse.
I mean, you can see it in different situations. I can't diagnose. I can point like this is the symptom I saw.
Well, if you see it, it's a sign, not a symptom. A symptom is what a patient tells you, right?
Sure.
Did the patient tell you the left side of her mouth was drooping, or did you?
No, it's what I observed.
Loss of body control and rigidity, right?
Correct.
And that's the rigidity that's commensurate with the decerebrate posturing, right?
Yes.
This was a nurse report sheet. Did this accompany the ambulance driver?
Yes, it's the handoff for the emergency room nurse.
Yes, ma'am. And did you also hand off a copy of Dr. Lee's note,
What note?
his operative note?
His operative note? I wouldn't send an operative note to the ER. I don't. Usually we have a transfer packet and that's what we send.
Okay. So that would not include Dr. Lee's note. Is that right?
If I sent it, I did. If I didn't, I didn't. But usually, no, I don't. I'm not sure.
Okay. That's just not your standard protocol is not to send that, right?
Whatever the ER asks for, that's what we send.
And you don't recall whether the ER asked you for his note?
I can't recall, no.
IV access. This is still lactated ringers,
Yep,
2 gauge needle. That L is left hand. Is that right?
correct. Yes,
Patient left ASC at 11:30 via EMS, transported to Cobb, and that's Wellstar Cobb Hospital.
yes.
And as best as you can recall, this is what went with Arlina Addison to the hospital. Is that right?
Not the incident report.
Which part would, tell me which part of this went and what, if anything else, went to the hospital with Miss Addison?
So the page you're on now would not have gone.
Okay.
That page also would have not gone, starting with the physician's order.
The physician's orders would have accompanied her to the hospital?
Yes, they should have.
Okay, and that's page, looks like 4 of 8 for this exhibit. What is this, 10?
9.
9, thank you. Exhibit 9. And what about page 6, tertiary care unplanned admission?
Yes,
That would have gone.
yes,
7, your nurse report sheet would have gone.
yes.
Page 8, I'm not sure what that is. Maybe it's
It's a continuation, but yes,
okay. Anything else that you're aware of?
not that I'm aware of.
I'm going to show you the this is, I believe, exhibit 6 to your deposition. You see the out time, 11:30?
Yes,
And that's the same time you would have prepared your incident report, is that right?
yeah, around that time.
Okay. Show you what's been previously marked as exhibit 10. This is an audit trial. And 11, which is an excerpt, let's see. Shows you what's been previously marked as Exhibit 11, which is an excerpt from the audit trail. Have you ever seen this document before?
No.
Can you see that? Is that a little small? Let me try to make it.
It's a little small, but I can see it.
I'll make it as big as my screen will go. And if we need to move it around, we can do that too.
That's better. Yeah, I can see better.
You good? All right. Actually, I'm gonna have to take a short, like a 2-minute break. I'll be right back. All right.
Okay.
Now, when you run the C-arm like you did on June 9th, you keep daily logs of the patients that are seen in the procedure room, right?
I'm not sure what you mean.
Sure, the machine logs the patients that are in there, right?
Yes.
And the patients that you use the machine on.
Yes.
Yeah, and that does that for every patient the entire day, right?
Yes.
And have you ever accessed those logs, that the daily log for the C-arm that you were operating on June 9th?
Have I ever accessed them?
Yes,
Like
ma'am.
in the CR machine?
Well, in any way, whether it's the C-arm machine or otherwise.
Are you saying like have I accessed the x-rays or?
Yeah, I mean, that's part of your patient's medical records, right?
Yes, I have not gone back in the C-arm, but I mean, the medical record I access.
Okay. And, but there, a log for that day for the C-arm is available, right?
Object to the form. You can answer to the
Yeah,
extent you know.
Not that I know of. I don't.
What may, oh, you've not read the operator's manual then, right?
Well, I know it only stores patients in there for 3 months.
Uh-huh, which would include for June 9th, right?
For 3 years ago, 2.5 years ago? No, I don't.
No, June, you said it saves it records the daily logs for 3 months. June 9th would have been there for at least 3 months, right?
Correct, yes.
And does someone delete them, or are they automatically deleted after 3 months? What's your understanding?
My understanding is they automatically just get to like go away after 3 months. I don't know what happens in the system, but we don't delete them after 3 months.
Or like the machine automatically tracks the time, right?
Yes.
So you're looking at, I apologize, Madam Court Reporter, what number are we? Yeah,
This is the excerpt. This is number 11.
okay, number 11. So do you see your name here? You see where it reads Arlina Addison, June, and Miranda Dudley?
Yes,
And that's you, right?
yes,
And your patient, Arlina Addison, that's the patient we're talking about.
correct, yes.
We're going to start, because this is in, I guess you'd call it reverse chronological order. I'm going to scroll down to the bottom.
Okay,
And the bottom, it starts at June 9. Do you see that?
yes,
And then it looks like on June 9, 11/22. So this is while you're still caring for Arlina. You viewed the medical record, is that right?
that's what it says, yes.
You viewed what, the recovery and the operative records?
Yes, that's
And
what
what
it
would
says.
have, I apologize, I didn't mean to cut you off.
I said, that's what it says, yeah.
Yeah, and well, any reason to believe that this is false or inaccurate?
No,
So you viewed the recovery room medical record on June 9th at 11:22 that morning. You were still caring for Arlina Addison, right?
yes.
And why did you view the recovery room record?
I don't know that specific time why I did. I mean, I created that charting, so I was probably actively charting. I'm not
Okay.
sure.
And that's what that would have been, you think?
To the best of my knowledge, yeah.
Yes, ma'am. And the same thing for the operative, do you see that?
Yes,
11/22, you viewed
Yes.
that portion of the medical record as well?
yes.
Okay. Do you have any recollection about why?
No, we go in and out of the church so many times.
I understand. And then again, this looks like page 110 of 192 at the bottom. And you can see over here 47 and 48 for this excerpt. And this is all these records are viewed on June 9th for Arlina Addison. This is while you're caring for the patient and completing the medical record, right?
Correct.
Same here. This is page 109 of 192. This is still June 9th, looks like.
Yes,
And this is when you're caring for the patient, still 11/22 and completing the medical record.
yes,
Page, you see this 108 of 92. More of the same here, right? Still June
Yes.
9, 11/22. Working backwards again, still now page 107. Now it's a little later, 22, 25, 11/39. You're still caring for the patient and completing the medical record, right?
yes,
Page 99 of page 99 of 192. Oh, I can get that to. Now she's already gone. This is 12/27, 12/35, 12/36. You're viewing the record, is that right?
yes,
Page 98 of 192, more of the same.
yes,
And what are you doing here? Completing the medical record?
yes, probably. To the best of my knowledge, yes.
Okay. Page 97, the same, is that right?
Yes,
96. We're up to about 1 o'clock now, more of the same, is that right?
yes, yeah,
95, more of the same. We're up to about a little after 1 o'clock that afternoon.
yes,
Now, there are additional patients that are undergoing procedures in the procedure room throughout the day, right?
Yes, not throughout the whole day, but I think up until lunchtime that day.
Yeah, so there would have been 10 or 12 patients.
Sure, yes.
And were you still running the C-arm for patients after Arlina Addison?
I don't remember
Okay.
that day.
Was there anyone else there to do it?
There's always someone else, yes.
I gotcha. Another RN that could fill that role, right?
Yes,
So page 95, more the same, is that right?
yes,
Page 94, more the same, complete
yes,
medical record. Page 93, 192, more the same. All viewed, still up to about 1:14 in the afternoon now.
yes.
Page 92 of 192. More, wherever it reads viewed, you're working in the medical record, is that right?
Yes.
Owner's been assigned, that means what?
Like when you modify the medical record, or like when you're completing the chart, you have to sign it. It kind of like locks it, and to get back in, you have to unsign it. I think that's just a way they can keep track of who goes in and out.
Got it. Now, this one entry, do you see where it reads 6/9/2022 at 13/14/27, 150? And I think that's 1:14 in the afternoon.
Yes.
And it reads created documents, case attachments. Now, what's a case attachment?
It can be a variety of things, like clearances for surgery, OR pictures, lab work. It's just where we keep files attached to that patient.
Okay. And one of the things you mentioned, OR pictures, you're talking about C-arm pictures?
C-arm, yes, sorry.
No, that's all right. And it reads here, OR pics, JPG, is that right?
Yeah.
And do you remember how many pictures you loaded to the medical record?
Just one.
Is that a pic with an S?
Yeah.
Something like that. Any idea why it's PICS instead of just,
No.
okay. But you only loaded one, is that right?
Yes. Yeah.
Excuse me. Then we've got department information created. You're still working through the medical record for Arlina Addison.
Yeah.
Still June 9th. Same for page 90 of 192, still June 9th. Right.
Yes.
It looks like you modified some records here. Recovery, you modified a record. Do you recall what you modified?
No, I don't recall.
And then here at 115, modified a record again. You see that?
Yeah. I don't recall. Yeah.
Page 89 of 192. Still June 9th, viewed, work list manually saved. What is that?
So that says recovery work list manually saved. So that's like, we have different work lists in the recovery charting, and that's just saying I saved the work list. It asks specific questions about the patient.
Yeah. Then we've got outpatient facility. Do you see that?
Yeah, that's the patient handoff. So that's me charting that she was transferred.
Okay. And we went through that earlier as
Yeah.
part of the incident report, right?
Yeah.
This is page 88 of 92, still June 9th. Got some more, you modified the recovery record again.
Yeah.
You don't have any idea what you did there?
No, it's probably all just part of the charting.
Okay. Work list automatically saved, manually saved. Are you talking about the work list that's included in the manual for the CR?
No, no, no. In our recovery charting, there's like multiple tabs and each one's called a work list. So when you complete that, there's multiple ones that you have to complete before they're discharged.
This is page 87 of 92. This is still June 9th, right?
Yes, yes.
Viewed, owner signed, you're signing off on records. 86, still June 9th, right?
Yes,
85, still June 9th.
yes,
84, still June 9th.
yes.
Again, you modified a record. This is, you modified an op note, is that right?
I don't know if it means the physician op note. I can't modify a physician op note. I don't have like clearance for that, so.
But you agree this reads modified physician op notes, and that's you, Miranda Dudley, at 13:25, 1:25 in the afternoon on June 9th, and you're saying that didn't happen, right?
I didn't modify the op note, no.
Okay. Who can log in as you other than you?
Hopefully nobody.
Okay. Page 83 of 192. We're still June 9, viewed, modified. Here it reads you modified. The area of care staff. The operative care staff, do you remember modifying that?
No,
Okay. What would that mean, modifying who was in the operating room during the procedure from 10:24 to 10:34?
it could mean different things. It could mean like modifying their like role or time, or it could mean a couple different things.
You don't have any recollection of that, and you can't tell me what you modified, right?
No, we do so much charting every day. I can't.
Understand. 82. Still June 9th, right?
Mm-hmm.
And you're reviewing the records, nursing notes. Now, I assume that was a yes. I know we all do the It's
Oh, yes, sorry.
all right. You can make Madam Court Reporter's job increasingly difficult with, yeah.
Sorry.
Nursing notes, the nursing notes created, viewed, signed off. Again, this is still June 9th, right?
Yes.
Page 81 of 92, still June 9th.
Yes.
And we've got page 80 of 192, still June 9th.
Yes.
Vital signs, 1436. Any idea what that means?
That's probably me just charting the vital signs.
Okay. Well, at 1332, 1436 hadn't happened yet, right?
Right. I don't
How,
know what that's about, but
what's that?
I said I don't know why it says 1436 there. It says UTC. Is that like a different time zone or something?
I don't know. I
No.
guess, yeah, what is that, a mean time or something? I don't know.
No.
If
Do you
don't
think
know,
that
don't
may be
guess.
it?
Okay.
What's that,
I
Tricia?
just said, if you don't know, don't guess.
Yeah. 79, still June 9th, right? All
Yes.
viewed. 78, all viewed, still June 9th. Viewed, owner assigned, all June 9th. Still June 9th, 76 and 192. Recording the vital signs here. This is page 75 of 192, right?
I can't see the page number.
Oh, it's.
Oh,
seven-
yes, okay.
Is that right?
Yes. Mhm.
More of the same, 74 of 192.
Yes.
Now, we look at page 66 of 192.
Mm-hmm.
This is the
Yeah.
following day, is that right?
Yes.
June 10th. Are you still completing the medical records on the following day, June 10th?
Part of it, yeah, part of our job is to do a post-op phone call.
Okay. And who'd you have that phone call with?
I don't recall.
Okay. Was Dr. Lee on the call?
No,
Okay. You were on the call with who?
we just, part of our job is like go in the next day, call the number that's listed in the chart to check on the patient. But I remember that I had to leave a voicemail. I didn't talk to her then, if I remember correctly.
All right. This is June 13th. This is page 57 of 192.
Mm-hmm. Yes, sorry.
So 3 days later, department information viewed, what is that?
I don't know.
Okay. Page 52 of 192, do you see that?
Yes,
This is Jennifer Self. Do you remember Jennifer Self?
yeah,
And she's no longer employed there, right?
correct, yes.
What is your understanding about why she's no longer employed there?
I'm not sure. I know she started her own cleaning business.
Okay. You see where it reads Arlina Addison,
Yes,
case attachments, deleted documents. Any idea what was deleted?
from the paperwork, it appears a different patient's chart may have been uploaded, the name that's on the PDF file, but I can't speak to that. I didn't.
Okay. $623, these,
Could we have the other patient's name redacted from the exhibit before it gets attached to the transcript?
I don't have an issue with that. I mean, we won't be doing, you'll need to do that and just supply the court reporter with an alternate. I mean, redact the one from the court reporter that's got my highlights in it and just. So, yeah, Madam Court Reporter, I don't have an issue with that being redacted.
Okay,
Okay.
Thank you.
What's that?
I just said thank you.
June 23rd. So this is like 2 weeks later. Do you remember what you were doing in the medical record of Arlina Addison 2 weeks later?
No clue.
Okay. Looks like you were viewing the operative portion of the medical record again. Is that right?
Mm-hmm. Yes,
And recovery.
yes.
And you reviewed it, let's see, 2, 4, 6, 8, 10, 12, 14, 16. $18, $20, 2, 4, 26, 28, 30. Like over 30 times, is that right?
It's only like a span of a couple minutes if you look at the time, but yes.
Okay. And that, and you don't have any idea why you were in there 2 weeks later, right?
No, part of my job description is to audit charts to finalize them. There's a list of incompleted charts, so I can't speak to why I was.
Okay. Operative printout, do you see that?
Yes.
Did you print out something?
No, it just says I viewed it, but I don't remember
This-
printing anything out.
I mean, this says printout, operative printout.
Yes, and to the left it says viewed also, but I don't remember printing anything out.
Okay. Show you what's been previously marked as exhibit. So this is 11.
This is 12.
12, thank you. Show you what's been previously marked as exhibit 12. This is a GE Healthcare GE OEC 9800. Operator manual, update and supplement. Do you see that?
Yes.
And this is a machine, this is the C-arm that you were using on June 9th.
Yes.
And you hadn't read this, right?
No.
Okay. Any reason to believe that what we were provided by OrthoAtlanta, Austell was inaccurate or false in any way?
No.
Okay. Show you what's been previously marked as exhibit 13. This is your redacted employment file, or what was represented to us. I think this shows that you had some training on the C-arm. I don't remember exactly. It was 6 hours, is that right?
Yes. Where does it say that at?
I don't recall. Let's see. If I can find it. There's a certificate of completion on page 12 of 37.
Yes.
This is radiation safety training. You
Yes.
completed that, right?
Yes, it's an online course we take.
Is that, you remember about how long that was?
Took me a while. I don't remember how long it was.
It'd take me even longer, so. Okay. And your CV, that accurately reflects your education, training, and background, right?
Yes, I've condensed it a lot, but yes.
Okay. a job description that accurately reflects what your job description?
Yes,
And that was your job description in June 2022?
yes.
You were also provided with an employee handbook?
Yes.
Let's see. That's your ACL. That's page 9. Is that right?
That's
That's-
BLS. Oh, that's ACLS, yes. And BLS, yes.
You recall having 6 hours of training though, right? On the C-arm?
Like I've had not like one-on-one with a radiology tech, but I've had a lot of on-site training. It's been way more than 6 hours, and that class at least took 6 hours.
Yeah, so that's what I thought earlier when I asked about training on that C-arm. You had on-the-job training, but no training other than that, right?
Correct, yes.
So
Besides the
that's-
online course.
Okay, well, the online course was for the C-arm or the X-ray training?
Yes, it's for radiation safety, and it kind of goes over like mechanics of a C-arm.
All right, so this is what you're talking about is what I have up on the screen, which is page 12 of 37. Is that right?
Yeah, yes.
Okay, and that wasn't C-arm specific training. That was radiation safety training. And some of that dealt with how a C-arm worked. Is that right?
A lot of it, yes.
Okay. And this total training, this was online and it was how many hours?
I can't say how many, it was a lot.
Okay. Goodbye. So there, you prepared that incident report, but there was no review with the team.
No, it's just kind of something we do for ourselves to kind of keep record. It's not like we don't do a big review on it. Our medical director is the one who usually reviews them, but we never hear back from him.
And who is your medical director?
Dr. Mark Duffield.
Do you mind spelling that?
Yeah, first name is MARK,
Yes, ma'am.
last name DUFFIELD.
Got it. Let me go through my notes and
Okay.
see. We've got the pre-procedure, procedure, post-procedure. During the procedure, it was not your responsibility, but the Miss Doyle, another registered nurse's responsibility to monitor the patient. Is that right?
She was assigned to that position that day.
And so she would have been responsible for recording vitals.
Yes,
Neurological changes,
yes,
pain,
yes.
any signs of improper needle placement?
She would have been responsible. Like, we're all responsible in there for that.
Yeah, but would you have been able to see that operating the C-arm?
Yes,
Okay. Now this picture, which has been marked as Exhibit 1, which I'm enlarging, do you see that black line with
yes,
drip and the dot coming out of it?
yeah.
What is that black line,
It's a TUI needle.
right? TUOHY is TUOHY, is that right?
Yes,
And it's 20 gauge, that's how big it is, right?
I can't speak to that one. How,
Okay. And then do you see where the line goes down and into the circle? Do you see that?
yeah,
I'll make it bigger.
yeah,
So this is like, can you see my pointer here?
yes,
So this is the tip of the needle, the point of the needle, right? Where my arrow is.
To the extent that you know.
to the extent that I know, I would consider that the top of the needle, but I don't,
The top of the needle.
yeah, it's, it has a hub at the top that shows up on X-ray too. And that's what it looks like, the hub of the needle, because the hub will show up sometimes on X-ray, depending on which needle he uses.
So the point of the needle is the top part up here?
From the best of my knowledge, yes, but I can't,
I understand, that's fine.
yeah.
So as far as where the needle placement, you would not have been able to determine the needle placement, is that right?
No, correct, yes.
And what about Miss Doyle, the registered nurse? She would not have been able to either, right?
No,
Only Dr. Lee would have been able to determine proper placement.
yes,
Okay. And are you aware of what's called contrast dye?
yes.
And how is contrast dye used in a cervical epidural steroid injection?
We use it to confirm placement.
Okay, and how do you use it to confirm placement?
We, well, Dr. Lee injects it into the TUI needle and he can see the pathway it travels up using the X-ray. It kind of lights up on an X-ray screen.
Okay. Do you see any contrast dye in Exhibit 1 to your deposition?
Can you make the picture, like, can you zoom out again?
Sure, sure, sure.
And again, same objection to the extent that you can tell as a nurse.
Can you zoom in a little bit too? Sorry,
of
it's
course.
just
You
very
just-
poor quality. I don't know if it's
No,
red
that's
top or.
fine. I'm gonna, well, this is what we were provided. What's poor quality about it?
I think it's my computer screen, because even when I see my, oh, there, I can see it better now that it's not
Okay.
highlighted.
So it might go darker when I move it, but I'll let it go. There we go. All right. You tell me when to stop.
That's good right there. That's good right there.
Okay.
Oh. Usually the contrast dye travels up and disperses. So in this picture, I cannot see any IV dye.
Okay. And what does that mean when you cannot see contrast dye?
Objection, lack of foundation. You can
You may
answer to the
answer.
extent that you know as a nurse.
So for this image is the final image. So we do fluoroscopy the whole time and he injects the dye. You can see it traveling up. Then this picture is taken after the actual steroid is injected. So that disperses the dye. So most times you do not see dye on the final image.
So image number 1 would have been when the dye was.
No, we don't typically save another image. I'm not sure what image number 1 was, but.
Well, see, the thing about it is, if you take a photograph after the dye is already gone, that's not going to tell you where the needle is placed, right?
You'd have to ask Dr. Lee how about how he does things. I'm not sure.
So what I'm asking you is you just testified that you saved the photograph that was taken when the steroid was injected, right?
Correct, yes.
And by the time the steroid's injected, that needle's already been placed, right?
Yes, that's how you inject it.
Right. But so the photograph that would show the placement, including the contrast dye that helps you ensure the correct placement, that's not this photograph, right? That would have been before this.
Dr. Lee sees this as a diagnostic photograph. I don't have the eyes of a radiologist or a physician. So, I mean, I can look at a bone and see something totally different than a surgeon.
Understand, but I want to make sure I get this right. You see no contrast dye in exhibit 1 to your deposition, the photograph, right?
Best of my knowledge as a nurse, no.
Okay. And what you interpret this photograph to be an injection of the steroid and the saline, right?
Correct.
And the contrast dye is injected before the steroid and the saline, right?
Correct. Yes.
And the contrast dye is injected to ensure proper needle placement, right?
Correct. Yes.
And it's there to ensure proper needle placement before the surgeon injects the medication and the
Yes.
saline. All right. And we don't have that photograph, right?
No, we don't
Executive
typically
order.
save that photograph.
And why is it you don't typically save that photograph?
I just save whatever Dr. Lee asked me to save.
Okay. And this is the one he told you to save, right?
Yes.
And so he didn't tell you to save any of the ones with the contrast dye, right?
Yes, correct. He typically, I mean, we just save the last photo always typically.
And the one with the contrast dye, how does the contrast dye best enable you as a nurse reading the C-arm as part of that team, tell whether the needle is properly placed?
I can't tell if the needle is properly placed as a nurse. More what I'm looking for is that we're at the correct level, like we're not doing lumbar instead of cervical. That's kind of what I keep my eyes on mostly, not needle placement.
Well, the lumbar,
I know it's far.
lumbar
Right?
versus the cervical, that's like 2 feet apart, right?
Yeah, yeah.
Have you ever had somebody that was supposed to be in the cervical and be in the lumbar instead?
No, knock on wood, not yet.
All right. And if you did, would you call a timeout?
I would say something. Yes, I would.
And I don't mean there would be nothing funny about that if it really
No,
happened.
no, but it would be ridiculous.
At the
Yes, so I
same
would say
time,
something.
it wouldn't happen. That's why we're,
Yes.
yeah. All right, I think, gonna take 5 minutes. I'll go over my notes. I think I'm done or about done.
Okay.
You all right with that,
Yes.
Counsel? Yeah, I got your.
Oh, oh, yeah, that's fine.
All right, probably 2 minutes. All right,
Okay.
thank you.
because of the cold, you know?
I know.
All right, a couple follow-ups and I think we'll get done here. It's my understanding that's the only procedure room there, right?
Yes,
And what's the turnaround time on that procedure room?
between cases,
Yes, ma'am.
oh, it can be like a couple minutes, like 2 to 3 minutes sometimes.
Yeah. And what do? Just sterilize the room?
Yeah, wipe down the bed, the positioning devices used, kind of like, you know, pull the C-arm back, get it in the neutral position. Yeah, just pick up.
And you do it before you begin each case, and by that I mean each patient, you make sure the machinery is operating properly, right?
Yes.
I think I want to ask you about a couple of policies, and I don't even, if this is what they are. I don't know that we need to do much more. Show you what's been, is this 13 on Porter?
14.
14. Apologize. Exhibit 14. You've seen this policy before, registered nurse operating room?
Job description, yeah.
Yes, ma'am. Now we go down to, and this is your, the policy and procedure you follow during the course of procedure,
Yes,
including the procedure, the ESI for Arlina Addison,
yes,
June 9th, 2022.
yes.
There's something, let's see. You agree the standard of care requires demonstrates dependability and accountability?
Yes,
This is 14.
15.
Damn. 15.
Yes.
Thank you. This is a policy for certification of professional personnel. Policy. Center recognizes its obligation to assure that all registered nurses, licensed practical nurses, and other personnel who require a license to practice their profession are currently licensed. Additionally, if it is required that any employee is required to be certified to practice in their position, it is necessary to verify that the employee is currently certified. Do you see that?
yes.
And are you aware of whether certification is required to operate a C-arm?
To the best of my knowledge, no certification is required.
Okay. Show you what's been previously marked as Exhibit 16. This is postoperative care. This is the postoperative assessment policy number CL 41. Do you see that?
Yes,
And you're familiar, this is the policy for a patient postoperative assessment, right?
right.
This would be applicable to Arlina Addison after her procedure on June 9th, right?
Yes,
Postoperative assessment surveys utilized to determine if the patient has a functional understanding of the postoperative instructions, determine level of care patients perceive they were provided during their surgical procedure, identify occurrences that should be addressed through quality risk management. You see number 3.
yes,
Number 4, assist the patient in assessing post-op care and or instructions if there's a perceived or actual need by the patient and or significant others. Is that right?
yes,
I think it's 11. Is there an 11? Let's see. Post-op patient phone call. That's what you were discussing earlier. You were required to make a post-op phone call.
yes.
Okay. And the purpose of that is to,
Just check on the patient, make sure that they're doing fine after the procedure. They're not nauseous or in pain.
okay. And then we've got the post-op survey. And we looked at an incident report earlier. Is this post-op written survey?
That's something that's given to the patient to mail back.
Okay. Do you know whether Arlina Addison received one?
Every patient receives, well, because she was transferred, it should have been in the discharge instructions that were attached, but I can't say that she did or didn't.
This is number 16. Is that right?
17.
17. Thank you. Shows you what's been previously marked as Exhibit 17. This is the fluoroscopy training and compliance agreement. Do you see that?
Yes,
And the policy here. To assure that it is the responsibility of OASCA. Do you know what OASCA is?
OrthoAtlanta Surgery Center of Austell, Oscar.
OASCA.
Yes,
So I mispronounced OASCA. That all radiation operators receive training specific to the equipment and procedures used at this facility. Do you see that?
yes,
It's your view that includes on-the-job training, right?
yes,
Okay. Compliance with the state of Georgia rules and regulations for X-ray. That's what we reviewed in your employment file earlier, right? That your X-ray training.
yes,
Chapter 295-2204 requires a minimum of 6 hours instruction to in safe operating procedures. That's what you had, right?
yes,
This training includes, but is not limited to, the proper training and the use of the C-arm, use of personal monitoring devices, quality assurance procedures, risk management, operating procedures. You see that?
yes,
You said there was C-arm training in that X-ray training, right?
yes. Oh, in the online course, yes,
Yeah. You don't remember what portion or how much, but there was C-arm.
yes. It went all into like the physics of how it works, and it was very in-depth.
Okay. And these operating procedures include policies and procedures for pregnant patients. That's not applicable here.
It is. Oh, not pregnant patient, but pregnant.
Oh,
employee.
yeah. You
I
didn't
was
have
really
great
far
detail.
along.
Gotcha. use of appropriate shielding devices, personnel monitoring, and equipment performance testing. Is that right?
Yes,
In the equipment performance testing, you were capable of testing to ensure that the C-arm was functioning properly, right?
yes,
And you did that before each patient, right?
for each patient, yes,
Including Arlina Addison, right?
correct, yes.
Okay. I've got two more of these. This is number 18. Is that right, Madam Court Reporter?
Yes.
What is that? I got one right. And so you would have put a lead apron on Arlina, right?
A lead apron on her?
You did. Did you put an apron on her around the surgical site or no?
No, we did not.
Do you not do that?
No, we don't. The exposure is so tiny, we don't put it on there.
All right. So it's been previously marked as Exhibit 18. This is transferred to a tertiary care facility. That's what we had, right? In Arlina's case. This is policy CL 46.0, which is applicable to Arlina, right?
Yes,
Policy, it is recognized that it may be necessary to transfer a patient to a tertiary care facility for acute care services and or an overnight admission that is not offered within the center. Is that right?
correct.
Procedure, emergency. Do you see number 11? I want to scroll down to 11.
Yes,
After the patient leaves the center. So that meant after Arlina Addison was transferred to, was it Wellstar Cobb? Is that right?
yes. Mhm.
Review the situation immediately with the personnel that were involved in the patient care scenario and ensure that everything is documented. Do you see that?
Yes.
And that's the incident report, right?
It's more so of like a debriefing among staff members to kind of go over it and say like, go over the situation and then I write the incident report. I don't know what order it happened in, but we do like a little debrief usually after.
And that debrief in this case was with Dr. Lee and Nurse Doyle.
Yes.
And also,
Anybody involved in the care.
okay. So Dr. Lee, Nurse Doyle, and Angela Day. Is that
Angela,
right?
yes. Mhm.
Who else was involved?
There was a nurse there that day named Rand.
Or A&D?
That's not, yeah, that's what it goes by. I don't think that's his real name. His last name's Presley.
Oh, okay. And he's a registered nurse?
He is, yeah, he's an ICU nurse.
Got it. Okay. Anyone else?
Not that I recall.
Is the debriefing recorded?
No. Mm-mm.
Okay, that's just a meeting.
Yes.
Do you know where that meeting took place?
No, it's not like an official sit down at a conference table type meeting. You just kind of gather and say like, what happened? What, if anything, could we have done differently? You know, that sort of thing.
Tell me everything you remember about that meeting.
I don't remember. I was charting half the time. I don't remember what was exactly said during that meeting.
Okay. Do you remember what was said generally?
Just kind of problem solving, thinking what could have gone wrong, like what the issue was, but we didn't come to any conclusion.
Okay. Show you what's been previously marked as Exhibit 19. And this is PACU 1 and 2, patient care, is that right?
Yes.
In this policy, all surgical patients will be admitted to PACU phase 1 unless otherwise indicated by anesthesia. What's the difference in PACU phase 1 and PACU phase 2?
It has to do with the type of anesthesia they receive. Our pain care patients, our procedure room patients, we don't have like a separate phase 1 and phase 2 area, so they all go to the same area.
Which is,
Um,
I apologize, go ahead.
what'd you say?
No, I apologize.
Oh, we don't have like a separate phase 1 and separate phase 2 area, so they all kind of go to the same general area.
And that's a phase 1 PACU?
Yeah.
Okay. And the procedures, patients' identities are verified. Routine phase 1 orders. Oxygen administered to maintain saturation above 92%. Is that right?
Yes.
And postoperative orders must be written by surgeons or attending physician.
Yes.
Dr. Lee in this case, and we reviewed those, right?
Yes.
All right. Anything that you do differently in the course of an epidural steroid injection since Arlina Addison on June 9, 2022?
No, nothing that we do differently.
Right, that's all I have.
Yeah.
Be safe, all right?
Thank you.
Yeah.
Thank you. Karen, if I need to send you a redacted copy of that audit trail, could I get your email address, please?
Yes, it's office@ACR for American Court Reporting, acrga.com.
And I think there are some, and some of the other depositions, you can speak to Spencer about that.
Okay, so maybe we can just do it all at the same time if it's gonna
Sure.
be for other depositions as well. All right, thank you.
Yeah, Spencer will have that information.
Okay,
Awesome. Thank you.
sounds good. Thank
Thank
you.
you.
Thank you for
So-
letting me start an hour later today. I appreciate
Not
it.
never an issue. I mean, thank you. Yep.
Mr. Potts, did you want to order the original?
Yes, ma'am. What, our standing order, electronic?
Okay. All right, thank you. Ms. Godsey, did you want to purchase a copy?
Yes, I'll do E-Tran with exhibits, please.
Okay, thank you. Ms. Beckett, did you want to purchase a copy?
I do not. Thank you, guys.
Thank you.
All right, thank you.
Thank you.